phones if you're not speaking so others can hear. Thank you for your compliance. And I will have, this is a presentation of Odisha Society of America's Health and Wellness Group and its international wing, Odisha Doctors International Association, Team Odia. So I would like everybody to hear the rules. I will have Miss Rashmi to come in and just briefly let you guys know. Thank you so much.
Thank you, Dr. Devashish Rai. Odisha Health and Wellness Group तरफରୁ ଆପଣ ସମସ୍ତଙ୍କୁ ବହୁତ ବହୁତ ସ୍ୱାଗତ. Today we will focus on the vaccination. We will see more details. But ଆଗକୁ ବଢିବା ପୂର୍ବରୁ like we have some disclaimer. This is not intended to replace any of your primary care. This service will offer consulting service, but not the treatment or medication. For अनुरोध take few moments and kindly go through the disclaimer so that we know what to expect from this session. Okay, thank you so much. Now I would like to invite again Dr. Devashish Roy, Chairman of OSA Health and Wellness Group.
Yes, thank you. Can you move to the next slide? Thanks so much. And you see here in this, we would like to let you briefly know the topic for today is COVID vaccine. Why me? And please mute your phone. Thanks. Okay, and now to start with, I'll have our senior, our guru, our mentor, Dr. Nanak Agarwal, to come for a few minutes. Thank you, Nanak Bhai.
Thank you. Dear brothers and sisters, Namaskar. I thank you all for being present at this interactive educational session of OSA Health Wellness. Our scriptures tell us that the prime determination of happiness in life is our karma. This essentially means a right action with the right attitude. I would like to share a short incident which I heard as a medical student, and that has influenced my life as a surgeon. A man was walking on a beach when he saw a fish thrashing on the sand. He picked it up and placed it back in the sea. His friends laughed at him and asked him, "How many fish are you going to save today?" He replied coolly, "But I'm sure I saved this one today." Friends, we do not know how many lives we will be able to help, but I'm sure, and assure you that any help, any act of love, even the smallest, is not insignificant. It will go a long way to provide oxygen or help to a critically ill patient, food to a hungry family, or an individual, or even a child. Little by little, all of us working together, we will succeed. That is our resolve. It is now my privilege and honor to request our OSA Health Wellness Group Chairman, Dr. Devashish Rai, to take over. Thank you all.
Thank you, Nanak Bhai. That's such a wonderful way to start with all the blessings. Rashmi, next slide, please. Okay, so I would like to welcome Ms. Archita Sahu, who is a great humanitarian and she's a Hollywood superstar. She's a social worker, UNICEF ambassador. She was a runner-up Miss Femina, and she is very passionately involved with us in our roles. And she's our global ambassador for OSA Health and Wellness and Team Odia, and a proud wife of Mr. Sabyasachi Mishra, our global ambassador too. Archita, to you. Thanks. Archita, are you there?
हाँ, मैं सुनी पड़ रही, हाँ.
Yeah. Voice to Subhani.
Hey, Archita, sir, देखिए सर. Live Archita. Archita.
Rashmi, the name is SHU. SO Hegala.
I think ଆମେ ଶୁଣି ପାରୁନୁ ବୋଧେ ଅର୍ଚିତା ସାହୁ ମ୍ୟାମ୍ କୁ
Yeah, we can't hear.
can we spotlight her
I think she is muted. Can you just check? She's unmuted.
Okay.
Uh,
Archita, unmute. Yes.
This is why can
okay.
we spotlight her if possible?
Yeah. How to use?
Thank
Yes. Go ahead. Go ahead, Archita. Sorry.
ओके सो प्रथमतः समस्त को नमस्कार जनबी आ आजिर दिनर एबेका टाइम रे मोर आखपाखरे हुंतु जो माने ऑलरेडी बहुत माने पाठ साठ पढ़ी छंती हुंतु बा जो माने टोटली जानि नाहंती कोन वैक्सीन विषय रे समस्त को मन रे जो गोटे सब बेले गोटे डर रहउची डाउट रहउची जे एक्चुअली वैक्सीन ता कोन ए टाइम रे नंबरटा ठीक कहीं एमती बहुत रे केसेस अच्छी जे वैक्सीन गोटे डोज परे हो कि दुटा डोज परे हो भी बहुत जन को ज्वर आसी ठंडा होती एंड बहुत रे सिम्पटम्स देखा देछि कोविड रो तो तेणु समस्त मन रे से जो गोटे डरटा अच्छी सेथि पई कि आई थिंक माने आपण मान भीतर तो मु जणे माने मु ही गोटे कहबी से जे मूर्ख बा मोर एते नॉलेज नाही किंतु आपण मान मु आज जानिबा को चाहूची कने मो भलिया आज बहुत जण जानिबा को चाहिबे जे वैक्सीन ता नबाटा केते जरूरी आउ वैक्सीन छडा वी हैव सम अदर ऑप्शंस और नॉट माने कोविड थारो दूर रे रहइबा पई सो एई सब मनर डाउट मोर अछि बहुत कॉमन लोकंकर अछि समस्तंकर अछि सेति पई कि आज माने हमर डॉक्टर्स माने अछन एक्सपर्ट्स माने आज अछंती सम बहुत खुशी लागु जे डाउट्स बडा सब क्लियर हबो
देवाशीष भाई अनम्यूट करंतु
Thank you, Archita. Very sweet of you. And God bless. And hope you are there with us. And let's go to the next slide. Thanks. Okay. So now I just want to give every one of you who is here the progress that we are doing. Apraman Janitebe, Odisha Society of America's Health and Wellness Group is doing a mega project to help the people of Odisha. So our progress report, let me just give you guys briefly. We have planned to have oxygen shelters in Titlagarh, Ganjam, Baleswar, Bhubaneswar, and Sambalpur is in discussion. Immediately, I may start to phase 1 rate Titlagarh and Baleswar. And we have planned also to serve food packages approximately around 5,000 a day. Locations are in progress, and it is going to start most probably by next week. And then we are planning to serve immigrants and try to rehabilitate them as much as possible, whatever means we can. And the fourth is to provide grocery package delivery to COVID quarantine families who cannot go out and are staying in hunger. So saying this, plus another aspect we forgot to mention here is ambulance. We have already placed to donate one to Titlagarh, Western Orissa, which will serve Titlagarh and Balangir Medical College. We have planned to give one in Baleswar, and then there's another plan going on for Ganjam district. Next slide, please. So this is our pledge. This is a GoFundMe. We have Gel, we have PayPal, and all the addresses are here. And I would request every one of you to please open your heart and join us and walk the walk. Thank you. And move to the next slide. Next. 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 Yes. So now coming to the main topic is, I will just want to say this program will have coordinators, Dr. Bashar Mahapatra, Dr. Sangeeta Pradhan, and Dr. Atush Naik. And next slide, please. So here, I just want to let you guys announce to you all, our next session, next Saturday, will be on some hot and burning topics. Number one is COVID and black fungus, mucormycosis, all you need to know. Number two is the mental health and the coping during pandemic. Then the third one is salute to the frontline workers and unsung heroes of the pandemic. Recently, we are seeing some violence and agitation, frustration on the frontline workers who are bearing the brunt. So we have decided to take that topic on the next session. Yeah, next slide. Yeah, so this is the topic, today's COVID vaccine, why me? You guys know, maybe there is an outbreak of disease, whether it's locally, nationally, or internationally, pandemic, scientists have rushed and developed vaccines. Vaccines have been tested, scientifically based, experimented, and approved. And when that vaccine is ready, between the vaccine to the people, there is a gap. There are many things in the gap, but one of the major important thing in the gap is fact versus myth. Eitaku bridge kariya pai, amara experts today from all over the globe, amara India ru, Delhi ru Dr. Samarendra Mishra is one of the speaker. Then from Cuttack ru SCB Medical College Medicine HOD, Dr. Jayant Panda will be the next speaker. And then we'll go into question and answer to try to clear as much as possible and help educate our people the importance of vaccine. So saying this, I would like to invite Dr. Basant Mahapatra to take over from here.
Thank you, Devashish. ମୁଁ ସମସ୍ତଙ୍କୁ ନମସ୍କାର କରୁଛି। ଆମେ ଏତେ ଭଲ କ୍ରାଉଡ ହେଇଛନ୍ତି। ଆପଣମାନେ ଜାଣନ୍ତି ଗଲା 200 ବର୍ଷରୁ ବେଶୀ ହବ ଫର୍ଷ୍ଟ 1796 ରେ ସ୍ମଲ ପକ୍ସ ରେ ଭ୍ୟାକ୍ସିନ ଆରମ୍ଭ ହେଲା ଦିନଠାରୁ ଆମର ଡାକ୍ତର ବୈଜ୍ଞାନିକ ମାନେ କେବେ ପଛକୁ ଫେରି ଯାଇନାହାନ୍ତି। ଆଉ ଏ ଭ୍ୟାକ୍ସିନ ହିଁ ଯେତେ ବଡ଼ ବଡ଼ ଇନଫେକ୍ସିୟସ୍ ଡିଜିଜ ଅଛି, ଆମର ବ୍ୟାକ୍ଟେରିଆଲ ଡିଜିଜ ହଉ, ଭାଇରାଲ ଡିଜିଜ ହଉ, ତା ପାଇଁ ଗୋଟେ ଅମୋଘ ଅସ୍ତ୍ର ଭଳିଆ କାମ ଦେଇଛି। ଗୁଡାଏ ରୋଗକୁ ଭ୍ୟାକ୍ସିନ ପୁରା ପୃଥିବୀରୁ ପୁରା ଲୋପ କରିଦେଇଛି। ଯେତେବେଳେ ସ୍ମଲ ପକ୍ସ ଭ୍ୟାକ୍ସିନ ହେଲା 1796 ପରେ, ତାପରେ it took some about 80+ years to get the next vaccine, cholera vaccine। ସେତେବେଳେ କଲେରା ଭ୍ୟାକ୍ସିନ ବହୁତ ଲୋକ ମରି ଯାଉଥିଲେ। ତାପରେ ଆସିଲା ରାବିସ୍, ଟେଟନସ୍, ଟାଇଫଏଡ, ପ୍ଲେଗ, ଟିବି, ଡିପଥେରିଆ, ଆପଣଙ୍କ MMR, ନିମୋନିଆ, ହେପାଟାଇଟିସ୍, ଏଭ୍ରିଥିଙ୍ଗ। and most recent ହଉଛି ଆମର ବୈଜ୍ଞାନିକ ମାନେ ସଫଳତା ହଉଛି କୋଭିଡ ଭ୍ୟାକ୍ସିନ। ତେଣୁ ଆ ଭିତରେ ଆପଣ ଜାଣିଛନ୍ତି ୟୁଏସ୍ ରେ ବର୍ତ୍ତମାନ ଆମର 3ଟି ଭ୍ୟାକ୍ସିନ ଆପ୍ରୁଭ ହେଇଛି। ଆଉ ତାପରେ ଇଣ୍ଡିଆରେ 2ଟି ଇଣ୍ଡିଆର ନିଜର ଇଣ୍ଡିଜେନ୍ସ ଭ୍ୟାକ୍ସିନ ହେଇଛି, ପ୍ଲସ ସେମାନେ ରସିଆନ ଭ୍ୟାକ୍ସିନ କରୁଛନ୍ତି। ଏଇପରି ଗୁଡାଏ ବୋଧେ 7-8ଟି ଭ୍ୟାକ୍ସିନ ଆସିଗଲାଣି ମାର୍କେଟକୁ, ଚାଇନିଜ ଭ୍ୟାକ୍ସିନ ଅଛି। କିନ୍ତୁ ଆହୁରି ଆ ଭିତରେ ବୈଜ୍ଞାନିକ ମାନେ almost 300+ vaccines in the process of development, ମାନେ ଏତେ ଜୋର କାମ ଚାଲିଛି। ତେଣୁ କିନ୍ତୁ ଦେଖିବେ କ'ଣ ହଉଛି, ୟୁଏସ୍ ରେ ଭ୍ୟାକ୍ସିନ ବହୁତ ଜୋରରେ 3ଟା କମ୍ପାନୀର ଭ୍ୟାକ୍ସିନ ହେଇକି ଆମର ପ୍ରାୟ 28 କୋଟିରୁ ଅଧିକ ଲୋକ ଭ୍ୟାକ୍ସିନ ନେଇଗଲେ, ଫୁଲି ଭ୍ୟାକ୍ସିନେଟ୍, about 39% of population। କିନ୍ତୁ ଇଣ୍ଡିଆରେ ଯେ ପପୁଲେସନ ବହୁତ ବେଶୀ, କିନ୍ତୁ about 19 କୋଟି, ଆଜି ସକାଳେ କାଲି ରାତି ସୁଦ୍ଧା ଆମେ ଯାହା ଦେଖିଲୁ 19.3 crores people have taken, about 3% of population। ଯଦି ଆମେ 60% କି 70% ଯଦି ପପୁଲେସନ ଭ୍ୟାକ୍ସିନ ନ ଦବା, ଏ ରୋଗ କେବେ ଯିବ ନାହିଁ, ଏ ପୁଣି ଯିବ ଆସିବ, ଏମିତି ୱେଭ୍ସ ଆଫ୍ଟର ୱେଭ୍ସ ଆସିବ। ତେଣୁ ଭ୍ୟାକ୍ସିନ ନବାଟା ଇଜ ଭେରି ଇମ୍ପୋର୍ଟାଣ୍ଟ। ଭ୍ୟାକ୍ସିନ ନେଲେ ନିଶ୍ଚୟ ଆମକୁ ପ୍ରୋଟେକ୍ସନ ଦବ। ଆମର କାମ ହେଲା ଏ ଡାକ୍ତର ଗ୍ରୁପ ଆମ ୟୁଏସ୍ ରେ କି ଆମ ଯୋଉ ଓଡିଆ ଗ୍ରୁପର କାମ ହେଲା ଯେମିତି ଭ୍ୟାକ୍ସିନର ଯୋଉ ପପୁଲାରିଟି, ଯୋଉ ହେଜିଟାନ୍ସି ଅଛି, ତାକୁ ଆମେ କ୍ଲିୟର କରି କେମିତି ଲୋକଙ୍କ ପାଖରେ ଭ୍ୟାକ୍ସିନ ଇନଫର୍ମେସନ ପଠେଇବା, ସେଇ ଯୋଉ ଆମେ ଏଇ ଯୋଉ ସେମିନାର କରିଛୁ। ଆମେ ବହୁତ ଖୁସି, ଆମ ପାଖରେ ଅଛନ୍ତି ଆମ SCB ମେଡିକାଲ କଲେଜର ପ୍ରଫେସର, ହେଡ୍ ଅଫ୍ ଦି ଡିପାର୍ଟମେଣ୍ଟ ଡକ୍ଟର ଜୟନ୍ତ ପଣ୍ଡା। ସେ ବହୁତ କମ ନୋଟିସରେ ଆସି ପହଞ୍ଚିଛନ୍ତି ଆଣ୍ଡ ସିଏ ବହୁତ ୱେଲ୍ ସ୍ପୋକନ। ଆପଣ ମାନେ ଓଡିଶାରେ ବି ଯୋଉମାନେ ଦେଖୁଛନ୍ତି ଜାଣିଥିବେ ଜୟନ୍ତ ବାବୁଙ୍କୁ, ସେଠି ସେ SCB ମେଡିକାଲ କଲେଜରେ କୋଭିଡ ଚାର୍ଜର ଅଛନ୍ତି। ତା ଛଡା ସମରେନ୍ଦ୍ର ମିଶ୍ରା, ଆମ ଡକ୍ଟର ସମରେନ୍ଦ୍ର ମିଶ୍ରା he's a very famous there in ID and public health, ସିଏ ଅଛନ୍ତି ସେ ସ୍ପିକର ହୋଇ। ତାପରେ ଆମେ ପ୍ରଫେସର ହିମାଟୋଲୋଜି ଅଙ୍କୋଲୋଜି ପ୍ରଫେସର ରବି ଜେନା ଅଛନ୍ତି, ଯିଏ କି ଆମକୁ କୋଭିଡ କୋଆଗୁଲୋପାଥି ଯୋଉ ବ୍ଲଡ କ୍ଲଟ ଉପରେ ବି କହିବେ। ସିଏ ବି he is kind enough to join। ସିଏ ଆପଣ ମାନେ ରବି ଜେନା ଜାଣିଥିବେ, ସେଠି ପ୍ରଥମ ଓଡିଶାର ପ୍ରଥମେ ଆରମ୍ଭ କରିଛନ୍ତି ବୋନ ମ୍ୟାରୋ ଟ୍ରାନ୍ସପ୍ଲାଣ୍ଟ। ତେଣୁ ଏଇପରେ ତା ଛଡା ମୋର ବି ବହୁତ ଆମର ପ୍ରଫେସର ସାଧୁ ପଣ୍ଡାଙ୍କୁ ଦେଖି ମୁଁ ଖୁସି ହେଲି, ମୋର ସାଙ୍ଗ ଯିଏ କି ଚିଫ ଅଫ ପ୍ରଫେସର ଅଫ SPM ଅଛନ୍ତି ବୁର୍ଲାରୁ। ଆଇ ଏମ୍ ସୋ ହାପି ସାଧୁ ଇଜ ହିୟର। ସୋ ଆମର ତା ଛଡା ଆମର ଇଣ୍ଟରନାଲ ପ୍ୟାନେଲ ଅଛନ୍ତି, ଆପଣ ଅତସୁବୁ ରହିଲା କୋଅର୍ଡିନେଟର, ସଙ୍ଗୀତା ପ୍ରଧାନ, ବିଜୟ ଥୋମାସ, ଆପଣ ଆମର ଅଛନ୍ତି ପ୍ଲସ୍ ଅଜିତ କାୟଲ ଅଛନ୍ତି ଚନ୍ଦନ ଗନ୍ତା I forgot Chandan Gantat. He's also assistant professor medicine MKCG, and he is also with us take some questions, and he is in charge of COVID there. एही पर हमर गोटे very strong panel अछंती बहुत लोग जॉइन करछंती तेनु वर्तमान मु कहिबी next will go to start Devasis. You can take over and go from there.
Dr. Samarendra Mishra is the first speaker. Yeah, go ahead, Samarendra.
Okay, thank you, Devasis, and greetings from New Delhi to everybody. I'll give a very short update because most of the time we will open it up for question and answers. Could I have the first slide, please?
Yes, sir.
As you know, Amara, the only weapon we have apart from treatment, we have seen that treatment, there are a lot of pluses and minuses. So the best weapon we have at the moment is the vaccine. And we have a lot of information. Some are not correct information, some are myths, some are very confusing information on the media. I think all the media channels run every day evening. They run sessions on clarifying a lot of doubts. But still, lokongo manre bahut misinformation achi, which has led to this vaccine hesitancy. So we will try to overcome all this. And the other thing which has been discussed is that India vaccine hey paribo kane ethava. If you look at with the 1.3 billion population, we were very successful in eradicating polio from this country, which was next to impossible. So I don't think if we give it, all of us give it an effort, it's not be possible. So as of 19th May, India, we have already fully vaccinated 4 crores. Well, that is 3% of the population. But if you look at the absolute number, 3% of 1.3, 130 crores is a huge number. And on people who have taken 1 dose of vaccine, whether it is Covishield or Covaxin, is about 145 million or 14 crores. That's 11%. Initial vaccine hesitancy, there was a lot of vaccine wastage also, but gradually it has picked up, and like a lot of hesitancy has been overcome over the past few weeks. Odisha, well, that has to be whatever is available with us as per the government data, but I think my colleagues from Odisha can update this. Odisha MT kichi, if you look at the overall India figures, Odisha is not far behind. Vaccine hesitancy is across all states. So Odisha be around 3% of the population, or the deserving population, have been fully vaccinated, and about 11% in Odisha have taken the first dose. Next slide, please. Okay, now we will not discuss a little bit ki aguku koko vaccine asibo. There's a huge list of vaccines in the pipeline. Jayapardanda se asini. Let's not discuss too much into it. Jo achi ama pakhare, let's discuss that. We know, we are very familiar with Covishield and Covaxin. There are two different companies. Covishield was in partnership with AstraZeneca, which is a foreign company, UK-based company, and we have our Serum Institute based in Pune. They were the first ones who rolled out. Now, recently, amara thila jetala vaccine start hethala, the dosage was given in 28 days apart. Now, there has been a lot of debate on this kai 3 mas hela. Now, as we get in any vaccine rollout, as we get more data, more into COVID ke expert thile barse agru. Nobody was an expert in COVID. But as we get data and as we roll out these vaccines, we have found out that 3 mas gap re, if the second dose is taken, the immunity is better boosted. Aguru thila jate jaldi nei jo bhalo, but no, you have to wait for the first immunity to boost up, and there's an optimal time jota ki second dose ta nei. So जो मैंने भाई ठीक है anxious कि मोर जल्दी नवा कथा vaccine, please be comfortable. The guidelines is that you can take the second dose after 3 months of the first dose. The efficacy is 90%, and we will discuss what later on during QA session. ये 90%, 70% कौन and 10% कहीं रही जाऊँगी. But then 90% is a good enough efficacy for any vaccine anywhere in the world. So that is one thing, that our Indian vaccines are not anything inferior to any other vaccine. The second vaccine is Covaxin, which is a fully Indian owned vaccine. It is developed by Bharat Biotech. Taro dose ta hochi 4 for 28 days. That still continues because that vaccine works that way. Every vaccine has a different way of working. So this vaccine has shown that after 4 weeks, if you take the second dose, the boosting is optimal, and it has an 81% efficacy. And the third one, which is very recent, May re asichi, is the Sputnik V. Now the Sputnik V is developed by Gamaleya, which is a Russian company, and India, Dr. Reddy's lab in Hyderabad has tied up to first initially import the vaccine, and subsequently they will be manufactured in India itself. Now that vaccine is a person the rollout only about 1.5 lakh doses have been received in the first batch, and it has to be taken in 3 weeks apart. And there's a little bit of a difference. The first dose ta jo nature, though it will be the second dose will be of the same company, but the dose preparation is a little different. And because they have found that dita alga type of vaccine with the same company, the immunity boosting is even better. And they claim to be a 92% efficacy. Now, kete amar achi vaccine, so there is a lot of thing. We have, I mean, within the next 3 months, we have enough vaccine that have been expected, procured, and available. Yesterday in the high level meeting, it was discussed that ko jagara vaccine besi hai jauche, ko jagara vaccine kom hoche. So a district level plan is being developed, Odisha re bhi sahi district level re, so that we know how many people need to vaccinate, how many dose needs to be reached. And if you look at it, we have already given about 88 million vaccines have been given across the country, including Odisha. So 8 inta vaccines, there are other vaccines in the pipeline, but I will not spend time waiting to Asivos, we'll discuss that. We have 2 other, and there is a nasal vaccine which is in the pipeline. When it will come, we'll take a call. Next slide, please. Okay, now to overcome the vaccine hesitancy, be assured that the virus will not bring us down. Vaccine hesitancy will definitely bring us down, because we have seen Israel, US, wherever vaccines have been given, even UK, people have slowly opening up. Normal life ko slowly. If you look at whatever you have seen on TV in Israel, that almost gone to normal. So vaccine is very, very important to get back to our normal lives. The other thing, has vaccine worked? Vaccine kamo karchi ki nahi? If you look at all the healthcare workers, they were the first batch who were vaccinated. Very few doctors have been infected, and jo mane infect heichande and had become serious, majority of them were not vaccinated, which is very surprising. Doctors should have been the first one. There should be no vaccine hesitancy among doctors. But unfortunately, doctor mane bhi bhabuchanti ame nabu ki no nabu. But then it is picking up. So majority of the health staff who have been vaccinated have been protected, have been safe. And what we can say with confidence, 2 doses of vaccine will prevent infection, not 100%. As I said, efficacy is 80-90%. You will still get infection, but it will definitely reduce serious illness and hospitalization. If you know, if your family members have gone to it, how difficult and serious it is to treat a COVID patient. So I would think that if you are shying away from vaccine, it is we are making us fight a very impossible vaccine. Then we will be with COVID for the next nobody knows how many years. I'll stop at that, and then we'll be open up for questions. Thank you so much.
Thank you, Samarendra. It was very nice, very nicely presented. And जो माने ओडिशा रो join करचंती, जो माने ओडिया बुझिबे, English बुझी पारुनांती, मो तंग एती कहबी जे डॉक्टर समरेंद्र मिश्र एक्सपर्ट हमर वैक्सीन है, से कहले वैक्सीन और फ्यूचर भलो, वैक्सीन निश्चय 2टा डोज वैक्सीन नेले आपण कहि पारनी इन्फेक्शन हेई पारे कोविड, किंतु बहुत कम तार कॉम्प्लिकेशन कम हो, आपण ज्वर हेई पारे, टिके हेई पारे, हॉस्पिटल जीवा को न जाय पारे, जदि भी जानती आपण सीरियस हेबेनी। तेनु सेटा ऑलरेडी प्रमाण ही जाईची। तेनु जो कहउचन समझ वैक्सीन केते इफेक्टिव 80% 90%, ता माने सेति लोकन करू ता छडा जो माने जो परसेंट इफेक्टिव न ता माने तांको हेई पारे, बट आपण को हॉस्पिटल जीवारो कि वेंटिलेटर पसिबारो निश्चय इफेक्टिव। तेणु समस्ते सेटा को मन रखंतु। तापर आमे जीवा हम प्रोफेसर डॉक्टर जयंत परणा जे अछंती एससीबी रो हेड ऑफ द डिपार्टमेंट मेडिसिन, वर्तमान से अछंती कोविड चार्ज रे, एंड वी आर हैप्पी टू हैव यू। जयंत, प्लीज गो अहेड।
Thank you, sir. Thank you, Dr. Bashant sir, and Debashish sir, and all my friends, and Archita and the Odia community of United States of America. Proudly, I am participating first time in such a gathering, and ମୁଁ ସମସ୍ତଙ୍କୁ ଅନ୍ତରରୁ ଧନ୍ୟବାଦ ଦଉଛି ମତେ ଡାକିଥିବାରୁ। ବହୁତ ଜଲ୍ଦି କହିବି କାହିଁକି ନା ଆମେ ବେଶୀ ପ୍ରଶ୍ନ ନବା। The right description about vaccine we came across by the Biocon head. All of you must have seen that in the social media, that it is like a arranged marriage. So I came across and it appealed me, and I also shared it in the Twitter, that before the vaccine came, the different gossips about the vaccine came, and people were motivated not to take vaccine. And after the vaccine came, people are confused. When people are called, they didn't go. When people are coming, vaccine is not available. The person who is vaccinated thinking that the other one could have been better. The Covaxin people think Covishield could have been better. And those who don't get any vaccine, they tell, give me anyone which is available. That is the right description about the vaccine at present in India. Odisha re आमे गोटे मोटिवेटिंग ग्रुप हेतिलु ओडिशा गवर्नमेंट गोटे इन्फ्लुएंस ग्रुप क्रिएट करथिला आमे माने प्रथमे नेचु होल कंट्री रो 16th January रे वी आर वैक्सीनेटेड फर्स्ट 13th February we took the second jab, and we told that this is a effective and without any side effect, and we tried to tell everyone that it is good. किंतु दुखर कथा कोन जे प्रथम रु एमिति किछि गुजब आसिला, के कहला निश दाढ़ी उठिबो झियो मानकर, के कहला मनीष कुंभीर होई जिवो. तो they could influence people so much that even healthcare group, we had listed 3.5 healthcare group, out of which only less than 50% turned in their schedule to take the vaccine, which was the first group to start from 16th January, the largest vaccination drive in the world. So government had to fight to call them, even threaten them that your incentives will be stopped if you don't take vaccine, because they're already listed out. The slot was open. Tapare ame senior citizen man ko dakile, comorbidity groups dakile, and till now, you see, it's almost 4 months, February, March, April, May, and we have not completed these groups, the whole lot. Healthcare personnel, only 90% people have taken. Kintu जहा आमे बहुत चेष्टा करिकि प्रथम 2 मास 3 मास रे करि पार नथिलु, सेकंड वेव हैज सक्सीडेड इन डूइंग दैट. सेकंड वेव एमिति क्रुएली आसिला, बेसी लोक सीरियस हेलेनी, किंतु जो माने क्रिटिकल हेले, we could not get them back. That is my impression. In comparison to the first wave, suppose 10% people are sick, we are getting back around 8-9% people. But here there are hardly 2-3% people get sick, and we are losing almost 1.5-2% people. And looking into this and the wave of second जो COVID-2 आमे कहिबा, जो family effect हेले, groups effect हेले, office effect हेले, at a time with no barrier, everybody came positive. People are scared. I'll tell, in Odisha, people are still scared. And in spite of all our explanations or demonstration of how second wave should be about, people still are confused to know that what should be our course of action, what should be our exact approach. And we repeatedly tell them there are two things: one is mask, one is vaccine. Upon जानले आश्चर्य हेबे, SCB Medical College रे जोठी we have capacity of vaccinating around 500 people a day. आमे जिते बेले डाकू थुलु 50 people, 60 people, even 100 करिवा पई प्रथम दिन मते 100 टा रसगोला देउ पड़थिला. किंतु वर्तमान even days we get 10,000 people for those 500-600 slots, and they come with token, and many of them create a chaos there. A big fight goes on to take the vaccine. So a confusion emiti, the laymen are much far from science. Iti jo mane achanti to spread the message which are authentic and which should be discussed. I'm telling the facts that though Odisha is at par, Dr. Shamarendra showed you that around 11% first dose and 3% 2 doses. We have Covishield, then the Covaxin, and though Covishield is most of the district headquarters and the districts are having, Covaxin is given only at Bhubaneswar, and Sputnik V we are waiting. I think will be receiving soon. The government's plan is to complete these slots of healthcare workers, senior citizens, followed by the comorbidity people with comorbidity, and in the youth group 18 to 44, ame already the koti vaccine the jojana karichu. The advance is paid and the vaccines have started reaching, and now actively this is rolled out. The 18 to 44 vaccination people are co-win apre semane registration karuchanti, slot paila pare asiki tankara first dose nouchanti. Jehetu the second wave is moving more towards younger mass, we want all youth to be vaccinated. Odisha has around 4.5 crore population. Ta bhitru jodi ame khali youth population 2 crores ku vaccinate kariba, we expect that we'll have a good herd immunity, because by this time a few people are already infected clinically and subclinically. Sero survey at times shows up to 60% antibody in different cities. That is the expectation, that is the plan. But to conclude, I tell the truth is very bitter that now, except few districts, most of the districts have closed down their vaccine centers because of scarcity of the vaccines. Though government has paid 700 crores advance, vaccine is yet to reach, and many times we don't receive vaccines in time, in spite our health secretary or health minister and people at large raise this voice that at once upon a time around 3 lakhs vaccinations a day was feasible. That came down to 50,000 because of scarcity, and now most of the vaccination centers are closed, most of the people are returning, and now things are little other way around, that people want vaccine and they don't get even a second dose in time. And you know, our extension of second dose from 4 weeks to 6 weeks, 6 weeks to 8 weeks, 8 weeks to 12 weeks, and 12 weeks to 16 weeks has been very badly criticized by people at large, even the literate and the intelligent group, that every month the schedule changes. Though there is science of taking the vaccine after 12 to 16 weeks. Initially, we started with 4 weeks and we are extending every time when the people are returning from the vaccination center. So I hope this meeting gives a clear message that vaccines are safe and effective, and in earliest available opportunity, you should start your vaccination process. For Covishield, 12 weeks should be the minimum gap between 2 doses. For Covaxin, it's 4 to 6 weeks. And Sputnik also will be launched soon and will be rolled out. That is for sure. And as soon as we take, because in our latest vaccination review, we have released the global tender, and we have changed the tender conditions even to accommodate vaccines which can be stored in -20° to accommodate few more bidders. And I'm sure it will attract more people towards Odisha for availability of the vaccine, and we can be rolling out very effectively and will not wait for vaccine to reach, and more in 4 months time we have a target of vaccinating this 18 to 44 around 2 crores. Thanks again for the opportunity, and I'll be happy to take any question.
No, thank you, Dr. Panda. It was very informative, and you spoke very well. Gote, exactly, before you told the last few sentences, I got exactly that question. I think I took one vaccine 2 months ago.
I'll just tell how to take the questions. Nihar is monitoring. I'm taking a complex arrangement to multiple Facebook live jauchi. Let's start. Nihar how to take the questions. Nihar, are you there? Quickly.
भाई हमें करिबा कि Facebook रे गुटे क्वेश्चन
Shall I ask you one thing?
Please.
Shall I ask you one thing? Is Professor Panda, how you attract, during the first wave, why the vaccination number is so low?
hold on, Dr. Kyle. Kyle, we have to explain how to take the questions. Then we'll take your questions. Okay, give me 1 second. Nihar, can you come in?
ଆଜ୍ଞା so
Sir,
ଆପଣ
ମୋର ଗୋଟେ question ଅଛି, sir.
ଲାଇଭ ରେ ବି ବହୁତ ସାରା କ୍ୱେଶ୍ଚନ ଅଛି so ବହୁତ ଲୋକ ବହୁତ valid question ମାନେ ବହୁତ ଭଲ ଭଲ question ପଚାରୁଛନ୍ତି they want to know so ଆମେ ଗୋଟେ କାମ କରିବା zoom ରୁ ଗୋଟେ question ନବା you can unmute and ask a question and next question ଆମେ Facebook ରୁ ନବା so sir go ahead and you can ask the question.
Go ahead now.
There's a question. Let me ask you. I got a question. That's why I was talking to Dr. Panda. जे जो कहिले.
Sir, am I audible, sir?
Yeah.
Yes,
Yeah.
sir.
Sir, am I audible? I am Professor Saroj SN Misra,
Yes, sir.
IGIT Sarangi, sir.
Please mute your phone, sir. You raise your hand. We'll take your questions. Okay. We are in the middle of a discussion. Raise your hand, sir.
Yeah.
We'll definitely take your questions. Thank you.
ନାଇଁ ମୁଁ ଖାଲି ପାର୍ଟିରେ କହୁଛି ମୁଁ ପ୍ରଫେସର ଏସଏନ୍ ମିଶ୍ର ହେଡ୍ ଅଫ୍ ଦି ଡିପାର୍ଟମେଣ୍ଟ କମ୍ପ୍ୟୁଟର ସାଇନ୍ସ ଆଣ୍ଡ ଇଞ୍ଜିନିୟରିଂ ମୋର ଗୋଟେ କ୍ୱେଶ୍ଚିନ୍ ଥିଲା
Sir, please raise your hand. We are in the middle of a question. Please raise your hand. When your turn comes, we will answer.
Mr.
Please,
Mishra, just send your question in the chat. Then we'll call you. Okay. We have lot of questions before you. We'll take every question. Don't worry. We'll take every question. So my question which already asked to Dr. Panda, जैसे कहिले जे 2 मास तळे जणे वैक्सीन नै से कहला जे मते कहले नेक्स्ट वैक्सीन नबु 6 वीक परे तापर कहले 12 वीक परे पुणी कहउचन 16 वीक. I am really confused. You know, I don't know if I want to take it. And can you explain if can they move it further and if am I safe? Say eta pacharchi.
Sir, for a lighter sense, a joke is again moving in social media. Next month, it may come that 1 dose is sufficient. And next month, somebody may ask if you're still alive, vaccine may not be needed. So to answer the question, first, when you took the first dose, it was scheduled at 6 to 8 weeks. But now the schedule has changed 12 to 16 weeks. And this is based in science. We have multiple research publications. You can ask why there is a shifting every month. This is basing on science. You see, you must congratulate our scientists that in 10 months' time, they have made a vaccine available, which is not there for a diseases which are more than 100 years with us, number one. Number two, with passing months, we have different knowledge regarding the antibodies. People developing antibodies after 4 weeks, after 6 weeks, after 8 weeks, after 10 weeks, we have studied. There are multiple publications from India as well as from other countries. Basing on that, the expert group had recommended that Covishield should be apart minimum 12 weeks. So I'll suggest you after 12 weeks, these slots will be open and you take it after 12 weeks of your first dose, though it's between 12 to 16 weeks. As per the latest recommendation, that is fine. And if you want to face the menace of the second wave, the present 70% antibody will already is helping you out. And the latest guideline you have to follow because there is no way out to open up your portal before 12 weeks.
Thank you very much. So, तापरे हमें गोटे फेसबुक रू गोटे क्वेश्चन आसी मु पढ़ी देछि. Thank you, Dr. Panda. And I'll give to Dr. Samarendra Mishra if you don't mind. Somebody, Mr. S.S. Roy from Prachi Institute of Mother and Child Care, Katak, Odisha. Se ama Punna bhaikara yeru bode. Tenu se lekichanti. After first dose of vaccination, if someone is infected with COVID-19, then when the second dose vaccines to be taken, number one. Number two is after second dose vaccination, if someone is infected with COVID-19 after getting cured, is there a way, is there any possibility of getting infected again? Dr. Samarendra Mishra, can you take this?
Okay, thank you so much. The first question is that first dose nela pare, first dose nela pare jadi infection over, right?
First dose
okay. Okay, the guideline says as of 2 days back, the Government of India guidelines suggest that you can take it up after 3 months after to full recovery from COVID. So 3 months pare, the second dose can be taken. The second part of the question is because the antibodies can continue for 3 months, then you are safe for 3 months before you can take the second dose. The second question is, mu dita dose nella pare mate hobo ki na? Yes, efficacy, no vaccine shows efficacy as 100%. The chances may be very minimal, but hey pare. Now, what the discussion right now at the global community is that it is possible that borse pare, because we don't know, vaccine rollout ro borse bhi hai ni. Borse pare, we will most likely the immunity level will be coming down. So there is a possibility that borse pore, even if we have a COVID after 2 doses, borse pore a booster dose might be necessary. But that is too early. As data comes, I mean data pile, we will know. But right now, you can still get COVID after 2 doses.
Thank you very much.
Can I add a point here?
Okay.
So, is that okay?
Who is this, please?
I'm Suman Das. I'm an associate professor at Vanderbilt University Medical Center, and I'm a virologist, viral immunologist by training, and also my lab is one of the centers, 7 centers by CDC to sequence the SARS-CoV-2 coronaviruses. So we also looking at the, right now we are following many vaccine and infection cases here. My lab is doing that. And what you find that the memory B cell, which is the B cell which remembers for rest of your life, is much more short-lived with COVID infection. So somehow the immune system is modified by the virus such a way that your memory doesn't stay along like you would see that in other cases.
Can you speak in Odia?
Again,
Who are Odisha people?
तो जो antibody theory होची, antibody theory होची गोटे B cell वाली cells, very small cells. Say cells गुड़ाक immune cells which have 2 forms. One is memory form. One is the plasmablast form, means they make a factory of antibody. So generally, ଯେତେବେଳେ 1918 flu ହେଇଥିଲା, and if somebody is surviving that flu infection, ମାନେ ଯଦି ବଞ୍ଚିଛନ୍ତି ଆଜି ପର୍ଯ୍ୟନ୍ତ, ତାଙ୍କର memory antibody ଥିବ from their infection in 100 years ago, and that's been shown. ଏଟା ଦେଖା ହେଇସାରିଛି research ରେ. But SARS-CoV-2 ରେ, that is one of the problem କି is memory pool.
ଶୁଣନ୍ତୁ, ତେଣୁ ଆପଣ କହୁଛନ୍ତି ଯେ ଆର short live, that is you say.
Yes.
That's not it. Because we have to go to questions.
Facebook ରୁ ଗୋଟେ ନିଅ, Facebook ରୁ
We have a lot of questions, but thank you, Suman.
Vasan sir, gote Facebook ru gote question achi. Somebody can take this one. Sir, please tell me. This is Prasant Naik. Sir, please tell me any viral affected patient taken COVID vaccine, any side effects. So, sir, technically, पचारचंदी कि जदि already COVID है सरची vaccine ले कौन side effect आसिबो?
अच्छा, Bijoy, can you take this question?
Yes, we have had quite a few cases of COVID infected patients who got the vaccines. They've had no problems at all. The most, they might have a slightly more of a response of body aches, but majority have no problems. So they can really breeze through it. No issues at all.
Acha. Okay, next question will take, Mr. Priyabrata. You raise your hand. Can you ask your question live? Yes.
हाँ सर, मु कहिबार थिला कि मोर जने सांग आजी कॉल करथिले तो तांकर 2 थर से कोविड टेस्ट करचंती किंतु नेगेटिव आसी से आज मते कॉल करी कहिले जे आ मोर ज्वर होउची आ काश होउची आ देह शरीरटा बहुत कष्ट होउची किंतु मो परिवार मध्ये होउची मु मेडिकल जाई परबी कि मते पचले मु तो कहले मु जानिनी किंतु तमे जाओ टेस्ट करी कि आ देखो जदी पॉजिटिव होला तो केमती जहाँ मेडिसिन दिया होची कि जहाँ भी ट्रीटमेंट करा होची करी बोली सेति हम पचाउथिली जे से मेडिकल जीबी कि जीबीनी बोली पचाउथिले तो सेति मो क्वेश्चन थिला।
अच्छा प्रियाव्रत, तमे कोड कहउछ वर्तमान? प्रियाव्रत
आज्ञा एडा होची मो बौद्ध जिल्ला।
अच्छा
जिल्ला।
अच्छा, मु आकु डॉक्टर चंदन, आर यू अवेलेबल? चंदन गंतायत, assistant professor medicine.
Yes sir.
Yeah, can you take this and answer this question? Thank you, Chandan.
मु जदि ठीक बुझिची ताले से पचरिया चाहउचंदी जे से 2 थर टेस्ट करचंती नेगेटिव आसीची कोविड रो। जदि प्रियत बाबू सुनी पाउचंदी तो कोन 2 थर टेस्ट करचंती कोविड टेस्ट नेगेटिव आसी से रैपिड एंटीजन टेस्ट करथिले कि आरटीपीसीआर करथिले?
ଆଜ୍ଞା ସେଇଟା ତ ମୁଁ ପଚାରିନି, ସେ ମତେ ଜଷ୍ଟ କହିଲେ 15-20 ମିନିଟ୍ ହଉଛି, ତ ମୁଁ
ତଥାପି
ସେଥିପାଇଁ
ଯଦି ବି ଟେଷ୍ଟରେ ନେଗେଟିଭ ଆସିଛି, ଯଦି କୋଭିଡ ର ସିମ୍ପଟମ୍ସ ଯୋଉଗୁଡାକ ଆମେ ଦେଖୁଛେ ସେଗୁଡାକ ଯଦି ତାଙ୍କ ପାଖରେ
ଆଜ୍ଞା
ଆସୁଛି, ସେ ଇନିସିଆଲି ହୋମ ଆଇସୋଲେସନ ରେ ରୁହନ୍ତୁ। ଆଉ ହୋମ
ଆଜ୍ଞା
ଆଇସୋଲେସନ ରେ
ଆଜ୍ଞା
ସେ ମନିଟର କରନ୍ତୁ ଟେମ୍ପରେଚର ଆଉ ଅକ୍ସିଜେନ ସାଚୁରେସନ ଯାହା ରହୁଛି ତାକୁ ମନିଟର କରନ୍ତୁ, ଏବଂ ଯୋଉ ପ୍ରିଲିମିନାରୀ ମେଡିସିନ୍ସ ଆମେ ପ୍ରେସକ୍ରାଇବ କରୁଛୁ ଗଭର୍ଣ୍ଣମେଣ୍ଟ ଅଫ ଓଡିଶାର ଗାଇଡଲାଇନ ରେ ବି ଅଛି, ସେଗୁଡାକୁ ସେ ବ୍ୟବହାର
ଆଜ୍ଞା
କରନ୍ତୁ। ଏବଂ ପରବର୍ତ୍ତୀ ପର୍ଯ୍ୟାୟରେ ଯଦି ଦରକାର ପଡୁଛି, ଯେମିତି କି ଯଦି ଅତ୍ୟଧିକ ଟେମ୍ପରେଚର ପରସିଷ୍ଟ କଲା କିମ୍ବା ଅକ୍ସିଜେନ ସାଚୁରେସନ 92% ତଳେ ଯଦି ପରସିଷ୍ଟେଣ୍ଟଲି ମେଣ୍ଟେନ ହଉଛି, କିମ୍ବା ଅତ୍ୟଧିକ ବ୍ରେଥଲେସନେସ କିମ୍ବା ଅଧିକ ପ୍ରୋଷ୍ଟ୍ରେସନ ୱିକନେସ ରହୁଛି, ତାହେଲେ ସେ ହସ୍ପିଟାଲାଇଜ ହବା ଦରକାର ପଡିବ। ବର୍ତ୍ତମାନ ପରିସ୍ଥିତିରେ ସେ ମନିଟର କରନ୍ତୁ ହୋମ ଆଇସୋଲେସନ ରେ ରହିକି, ସେଇଟା ଆଇଡିଆଲ ହବ।
ହଁ ସର୍,
ଥ୍ୟାଙ୍କ ୟୁ।
Thank you so much. Very, very nice. And ତାପରେ ଆମର ଆଉ କିଏ ହାତ ଟେକୁଛନ୍ତି?
ସେକେଣ୍ଡ କ୍ୱେଶ୍ଚନ ସାର୍, ଏଠି ଫେସବୁକ ରୁ ଜଣେ ପଚାରୁଛନ୍ତି, ମିସ୍ କବିତା ପାତ୍ର, ପ୍ରେଗନେନ୍ସି ରେ ଭ୍ୟାକ୍ସିନ ନେଇ ହବ କି ନାହିଁ?
ଆଚ୍ଛା, Julie, are you there? Julie Samantray, can you take this question? If not, Sangeeta, can you take this question? Sangeeta Pradhan.
So ଏଇଟା ମାନେ question ଟା ଓଡ଼ିଶାରୁ ନା ଏଇଠୁ?
ଓଡ଼ିଶାରୁ ପଚାରୁଛନ୍ତି।
So I would refer this to Dr. Samrendra Mishra, because Odisha vaccine guidelines I'm not up to date and I don't want to share any wrong information.
Samarendra, please.
Yes, the guideline still says that pregnancy re vaccine diya houni. The expert committee is still basikre bichar kurchanti, and most likely bahut jaldi asibo, because they have already got a okay for lactating mothers. Pregnancy pore lactating mothers ko diya hochi, so very jaldi mate laguchi. Baki internationally ja jana padchi, pregnancy re vaccine is still quite safe, so maybe India re bahut jaldi guidelines asibo. But Ajikar guidelines, there is no vaccination during pregnancy.
Yeah, that's true. That India has not formalized the protocol yet, because yesterday I was talking to AIMS guidelines and PGI guidelines. They have not recommended any vaccination for the pregnant people.
Acha, okay. That is one question I just got. Before I go to some hand saying, I got more COVID. I got COVID after 7 दिन vaccine नेलार 7 दिन परे मते COVID ହେଇଛି. I am recovering. जो COVID positive आसिला, is it due to vaccine? ओडिसा जण पचारचंती. And जदी हला should I take, माने मु आउ second dose नेबी कि नाही? Ajit, can you take this? You are there? No, you are.
Thank you for informing. Yes, after 7 days, normally the antibody formation happen after 2 to 3 weeks. So it's very likely you can get infected after the first week. And even if it is infected by first week, but you need to take the second dose as the norm. After nowadays in NHS and UK, they're prescribing 6 weeks. If you are well enough, you are physically fit, then you can take after 6 weeks of subside your symptoms.
Achha, thank you. Achha, next question is Facebook.
It's 12 weeks in India, sir.
Okay, 12 weeks in India. Okay.
So next question, there are several suggestion and question raised in Facebook. बहुत से लोग कहते कि हमें वैक्सीन पाउनु केमती ताकू schedule करिवु. तो हमरो total discussion आज होची वैक्सीन रो question like myth गुडा को clear करिया पई. तो ता ऊपर हमें किछि टिप्पणी देई परिबुनी. So next question जणे पचारचंदी पद्म पटनायक, I am COVID positive after taking my first dose.
You can ask Samarendra about the vaccine. Is available? Is a good question. Loko chahuchandi vaccine miluni. Is there enough vaccine available, or can you see Samarendra in next month or 2 coming in? Loko chahuchandi.
Yes, Dita Jinso as an update. Yes, that has been an unprecedented demand for vaccine. Amara jete vaccine plan hitala to be rolled out, sete may not be available. But jemti order aggressively order place kara hiche, prati state भी तांकरो open करचंदी global tender. So तांकरो जो anticipated जो अच्छी estimate June, July, August bhitere there will be enough vaccine that is required to be provided as per the target population. So whatever the government feedback is that from June onwards, vaccines will be surplus supplied. That is why the government कहिचे सब district level रे plan बनाओ कि तम प्रत्येक district रे केते vaccine दरकार केते लोकन को दिया हबो. So सेटा urgent basis रे सब state government को कहिचे पठेया पे, but the state government themselves have opened up the global tender. So मतलब होचे June सुधा vaccines will be available in adequate number.
So Samarendra, just more गोटे question. मु काली गोटे न्यूज पढिली इंडिया रे दिन को लेस देन 1.5 लाख वैक्सीन दिया होची. हमरो यूएस रे 30 to 40 lakhs वैक्सीन दिया होची per day. किंतु what is the number, why so low?
No, actually Kalira, if you look at the 11 lakh vaccines have been given across the country. Not 1.5, it's 11.5. So 11 lakh vaccine diya hai, but it should go up. It should go up.
Acha, let's go. Thank you very much. We'll go to next question. Nihal,
Mr. Padma Patnaik Odisha ru pacharchanti, I am COVID positive after taking my first dose. What is the real time gap to take the next dose?
Well, केत दिन परे, how many days परे?
Again,
first days रो केत दिन परे COVID positive. हम से discover हमें
एटा को से मेंशन करि नांती से लिखिचंदी खाली हम COVID positive after first dose. केते दिन परे मु next dose टा नेबी.
अच्छा, join.
How many days after he is met positive?
Dr. Pandey, can you take this question?
Yes, sir. Already discussed 12 weeks.
Yeah.
3 months. 3 months.
3 months.
Thank you.
Basant bhai, thank you. Thank you. It will take a little change in course. We have a lot of questions there. We have to steamroll. Every response should be 30 seconds, please. No, we cannot take all the questions. I would request Sangeeta Pradhan to come ahead. And then we have Dr. Attosu Naik, Basant bhai ji koile. He'll be also there. So we have to speed up and keep the response to 30 seconds. बहुत बुरा question set ही रही गलानी.
बहुत सारा.
Yeah.
We should not repeat the question.
Right. Thank you, Basant bhai. Thank you so much. And
Yeah.
There are some questions in the Zoom as well. Can we also take turn like Facebook and Zoom that way?
Yeah, we should do that.
Yeah.
There are a lot of pending questions from
Zoom ru ki padhantu question.
Rashmi, you want to control the Zoom questions, and Nihar, you can do the Facebook ones, and then live be the Kipara.
Yes. My question is, my brother-in-law has MDS type 1. Can he take vaccination?
Dr. Thomas, you want to take this question?
Yeah, MDS is, I guess it's myelodysplastic syndrome. So myelodysplastic syndrome, the immunity may be definitely less. And the one thing is we have to see what all medicines he's on. He definitely needs a vaccination, but I'm not sure about in the US, we would give the vaccination depending on his condition. I'm not sure about India. So I guess Samarendra or Dr. Panda can comment about India. So, but definitely we would give the vaccine, but the response may not be as good because since he's already immunosuppressed.
UK
the present vaccines available
to
in
these patients. Sorry.
Dr. Panda,
the present
Dr.
vaccines
Panda,
which are available in India, they don't have any contraindication. Though Covishield has been questioned for some coagulopathy, the incidence is very, very, very rare. And being MDS, he is the person who requires vaccine because they are having comorbidity. So he should take it earliest.
So can I come in?
Yeah. Sorry.
Yeah, Professor Jenna.
Please, yeah.
Thank you very much. बहुत धन्यवाद. जेतबेले मन को क्वेश्चन टा है माइलोडिस्प्लास्टिक सिंड्रोम टाइप 1 रे केवल एनीमिया थाए हीमोग्लोबिन कम थाए किंतु टीएलसी काउंट एब्सोल्यूट न्यूट्रोफिल काउंट एवं प्लेटलेट को नॉर्मल थाए. सो माइलोडिस्प्लास्टिक सिंड्रोम टाइप 1 से मान एते इम्यून कंप्रोमाइज नोती हेले भी वेरी माइल्ड कैटेगरी. सो आई डोंट फाइंड देयर इज एनी कंट्राइंडिकेशन तांको मान वैक्सीन दबा पाई. सो माइलोडिस्प्लास्टिक सिंड्रोम टाइप 1 शुड बी से मान को माने वैक्सीन दबा उचित. दैट्स ऑल.
Thank you, Rob.
Can I say, Dr. Pasupati, this is very important thing.
Thank you.
Why the
So,
cardiologist has
next
died?
question?
The reason is that if he is taking any immunosuppressant or if he is taking any steroids, he should give a gap of at least 3 weeks before he taking the vaccine. Otherwise, you will not produce any antibody in your body.
Thank you.
So you have to be careful.
Yeah.
Again, I think I'll
Let's hold on.
No, I will clarify this point.
Yeah, go ahead. 30 seconds, sir.
Let Robbie.
Yes. Look,
Yeah, 30
yes.
seconds,
Look,
30 seconds. Thank you.
again এটা বহুত মানে মানে ভালো পয়েন্ট উঠেছেন बट माइलोडिस्पेटिस सिंड्रोम टाइप 1 को ना स्टेरॉइड दिया जाए ना कोनोसी इम्यूनोसप्रेसिव थेरेपी दिया जाए. So if you look at the management of myelodysplastic syndrome 1, steroids have no role, nor any immunosuppressive therapy. That's my
I
question.
think
That's
our
over.
question is answered. Bottom line is so vaccine nebe. So let's go to the next question.
So Facebook question ଏବେ next ପଚାରୁଛନ୍ତି ସୁଶୀଲ କୁମାର ସାହୁ ସାର୍ କହିବେ କି ପ୍ରଥମ ଥର କୋଭାକ୍ସିନ ପରେ କୋଭିଶିଲ୍ଡ ନେଲେ ହବ କି? So basically ସେ ପଚାରୁଛନ୍ତି କି ପ୍ରଥମେ ଯଦି କୋଭାକ୍ସିନ ନେଇଛନ୍ତି ସେକେଣ୍ଡ ଡୋଜ ଟାକୁ ସେ କୋଭିଶିଲ୍ଡ ନେଇ ପାରିବେ କି?
So Dr. Kyle, you want to take this one?
Right. Okay. Now this is a big, the big debate is going on. So this is the recently data has published in BMJ about 2 weeks ago, that the chances of interaction happen if you're taking the Covishield or Covaxin with any other vaccine. The chances of reaction can happen, but these chances is much more compared to the if you're taking the vaccine alone. Same vaccine you took, that is much better.
Yeah. Okay. Let's go to the next question.
Zoom question.
Yeah.
That's me.
Question hochi, this is from SS Roy from Prachi Institute for Mother and Child Care, Cuttack, Odisha. He has 2 questions. I hope he or she. After first dose of vaccination, if someone infected with COVID-19,
I mean, we already answered that.
Sorry,
we answered.
Repeat the question. Yeah.
infected 29, after getting cured, is there any possibility of getting infected again?
We already answered that question.
Already answered. Move to next question, please.
Next question is, a 37-year-old patient is cured after being COVID positive. After how many days she can take her first dose of vaccine? I think this is done too.
I think this is answered as well.
So also answered. Yeah.
The short answer is 3 months. Just
Next.
And the next one is, can we take 2DG as prevention for COVID? I'm Professor S.N. Misra, HOD, Computer Science, Dhenkanal. I'm 54 years old.
What was that? 2?
Actually, let me take this.
Yeah.
2DG is 2-deoxyglucose. It's a drug by DRDO and Dr. Reddy's, which has been recently launched in India. It has not been recommended for prophylaxis. It's a drug which is being given in moderate patients to increase the oxygen saturation.
Okay, thank you.
Actually, it is cheat to cheaters. Actually, glucose, that is your artificial glucose will be given. ତେଣୁ ମୁଁ ଗୋଟେ ଏଥିରେ ପଢିଲି ଯୋଉଟା କି ଆମର ହୋମ ମିନିଷ୍ଟର ଆଉ ଇଏ ସେଟାକୁ ଇନାଗୁରେଟ କରିଛନ୍ତି, ମାର୍କେଟକୁ ଆସିଯିବ, ଯେ ସେଇଟା ଭଲ କାମ କରୁଛି ବୋଲି କହୁଛନ୍ତି। ତେଣୁ ସେଇଟା ନେଲେ ଭଲ କି ସେଟାକୁ ପ୍ରିଭେନ୍ସନ ହିସାବରେ ଆମେ ଖାଇପାରିବୁ କି?
Not recommended, sir. Actually, market ku asigolani already. We have started using in patients, but prevention by it's not recommended.
I think data shows that there is no prevention of death. It's only reduce the days of symptoms. Nothing more than that.
Yeah. Let's go to the next question.
Next question.
Okay, thank you, sir.
Somebody has raised hand also.
Yeah. Let's go to her. Can we unmute Abhipsa?
Call their name. They have to unmute.
Abhipsa Nayak, are you there?
Hello, ma'am. Ma'am, my question is, if the vaccine is given to a pregnant lady, it is safe, and what if she took the vaccine without any recommendation to the doctors, what side effects she will have, and what will be the reactions to the fetus?
So it is a very, it's a loaded question, but I will answer this. Basically, we try not to do it, as you heard from our experts. Do not take the vaccine during pregnancy. And it is very new right now, so we don't know what the consequences are going to be. Hopefully there will be nothing, but they can have like viral syndrome jemti hue after any other vaccine, jara hei paribo ki kaso thanda jaha hei paribo, just jemti hue any vaccine nela pore.
Okay. So
Okay, ma'am.
next question hochi Facebook thread ru R Swai se pacharchandi ki heart problem thile vaccine nele chalibo ki nahi? I can answer this question. So heart problem thile vaccine nabata nihati recommended because you are in high risk, तुमे high risk COVID तुमको हेले complication हबार chance बहुत अधिका, ସେଥିପାଇଁ it is definitely recommended you should take the vaccine as soon as possible.
Nihar, I will just add couple of more things.
Yes.
Actually, ତମେ ଯାହା କହିଲ is absolutely right. Anybody who has got any kind of heart problem, they should take the vaccine. And most of the time, people ask me, I am on Coumadin or I'm on anticoagulation, I'm taking aspirin, Plavix. Can I take the vaccine? The answer is yes. You can take the vaccine unless your INR is more than 10 or you are actively bleeding. Then, because the problem is if you take a intramuscular vaccine, then you may bleed. So if you are on blood thinning medication, then you have to be a little bit careful, keep the vaccination site pressed for maybe 5 to 10 minutes and watch it. But any kind of heart disease, there is no contraindication. Even if you have mechanical heart valve or biological heart valve, doesn't matter. You should take the vaccine.
Okay. Thank you. Thank you, Atus bhai.
Next question.
Next one.
From Zoom, can one take two different type of vaccine? For example, the first dose of Covaxin and second dose of Covishield.
We already
addressed this.
Discussed.
Next one.
Specific test to access the loads of antibodies in a person after getting two doses of vaccine. My question to my friend Professor Jayant Panda. This was from Pavitra Nayak, Nepal.
Can we have Dr. Sadiq answer this question? Dr. Sadiq, are you there?
The question is asked to Dr. Ponda.
Yeah.
Okay.
Jayant
Dr.
Panda.
Panda.
It was by
Yeah.
Pavitra Nayak, who already raised his hand also.
Yeah. The first question you asked, I think is already answered. That
Yeah.
it's preferred to take the same vaccine in the second dose. ଆମେ ଯୋଉଟା ପ୍ରଥମେ ନେଇଛେ ଦ୍ୱିତୀୟରେ ବି ସେଇଟା ନବାଟା wise. ଦ୍ୱିତୀୟରେ ସେ ପଚାରିଛନ୍ତି antibody ବିଷୟରେ.
Again, what are the specific tests to access the loads of antibodies in a person after getting?
The best is neutralizing antibody. You ask any lab, they are doing it to get a neutralizing antibody level, and any level more than 1 is significant.
Dr. Panda, is it recommended by a person to get an antibody level after the vaccines?
No, sir. Actually, it's not a normal recommendation.
No.
But if you want to see the response, because it also depends on your immune condition, and after first dose, after second dose, and after 4 weeks of the second dose. So what I'll advise you, please go after 4 weeks of second dose to see whether you have adequate antibody level or not. That can give you a confidence that you have a good level, and maybe after 7 months or 8 months or a year, you can reassess and plan the booster dose.
Now the reason I'm asking you is, in USA, we generally do not recommend that you should check your antibody levels after the second dose. So if we start saying that you have the option, are we not asking people or just encouraging people to go and get their antibody levels?
No.
Sir, here also there is no guideline, but people show moto go, and what I see during the COVID profile, people come with an antibody level. Along with CRP and D-dimer, they are showing the antibody level to us. They come with a full battery of tests, including HRCT, thorax, and the antibody. So it's no more in the doctor's prescription. It has gone to the people's choice.
Exactly.
Okay. Can we move on? Thank you.
Next question je hath raise करछन तांको कहंतु.
From Das, there is.
Hello.
From Das.
Can I ask the question? Hello.
Yeah,
Am I audible?
Yes.
So my question is tell something about pediatric vaccines, when they will be coming. And another thing is, we have taken 2 vaccines, when we will take the booster dose.
ओडिसा रो कहउछंती ना कोड
आज्ञा सर आज्ञा ओडिसा रो कोची डॉक्टर प्रेमकांत महांती दुईटा क्वेश्चन अछि मोर गोटे ला फर्स्ट ला पेडियाट्रिक वैक्सीन विषय टी कोंदु केबे आसीबो कोन करिवो आ सेकंड ला हमें दुईटा डोज नै सरछु बूस्टर केबे नबो कोनी
either Samarendra, can you answer this?
Yes, as per the Bharat Biotech feedback, tankara June re arambho korchoti trial for age 2 years to 17 plus years. Tankara se kahile हमको 3 मास minimum lagibo to complete the study and share the data for approval. So October, November will be the earliest where the vaccine will be available for pediatric population. Second question was, what was the second question?
about the booster dose. When we get the third booster.
as I said, internationally there is a discussion going on that what an annual booster darkar padi pare, but there is no recommendation right now. Borse pare, as we said, antibody level kete paduchi, kete jauchi, kete reinfection hochi. Based on that, a booster will be required, but most likely a booster might be required.
And especially when the virus mutate further, we might need booster.
No, we have already recommended to the booster dose in UK, United Kingdom.
Ajit, when it is going to be available?
It's from November onwards.
November onwards? Okay.
Yeah.
Okay.
And this is in 7th month?
Yeah.
The Pfizer
it is from 11th month onwards.
11 months.
11 month onwards.
Is there any scientific basis for that? 11 months?
Yeah, we have checked we have about 30,000 patient has recruited checking the antibody level.
Okay.
And we have found the antibody level has declined after 9 months.
Professor Panda, just a follow-up question. If a patient comes after second dose of vaccine, 4 weeks after second dose of vaccines, and he has low antibody titers, or say about 6 weeks after that, are you going to give him a third dose?
It may not be useful, sir. May not be useful. Because
that's what I'm saying.
It shows that he is immunocompromised, and as discussed, the B cells are unable to process much antibodies. Patient may not benefit much, and he has to move around the mask. Cannot take out mask very comfortably.
That's what I just want to re-emphasize to our listeners that this myth of getting an antibody titer level after second dose is a myth, and that we should, as a medical community, we should not encourage it because we have no answers of what to do after that.
Exactly, sir. Exactly.
Nanak bhai, you are 100% right. There is no indication to do the antibody level after the vaccine. Anywhere in the world.
Thank you all.
We are already into over 1 hour into our meeting. Can we move on with the question?
Next question, Facebook group, Padma Patnaik karo. Sir, is it true that Covaxin is not approved by WHO?
Someone can answer this question, please.
Yeah, somebody.
Yes, both the vaccines. Yeah, both the vaccines have been approved by WHO.
Yeah.
No, Covaxin. She's right.
Covaxin.
Covaxin is not approved.
Yeah.
Okay.
I also have a question in the Zoom chat. I will just discuss that one. There's a lot of discussion about this black fungus. It's nothing but a fungal infection, which is common with steroids. But please do not panic about it. It is only when it's given for a prolonged period of time and very high doses, sometimes in the hospital, and it's treatable. It's not if you take some steroids orally for 5 days outpatient that you will get it. So ए जो फंगस ब्लैक फंगस कथा समस्ते कहउचंती जो आपण माने घरे जदी 4-5 दिन पई स्टेरॉइड तमर आपण को डॉक्टर कहिचंती खाइले सेटा हबो नाही तेनो सेथि पई प्लीज व्यस्त होइकरी पैनिक हुअंतुनी
and mostly
especially in diabetics.
Diabetic patient,
Yes, we are discussing that next session. Maybe we are discussing.
Yeah, सेटा पुणी आमे नेक्स्ट सेशन एड्रेस करबा.
Okay. Zoom रे की हाथ रेज करचंती नेक्स्ट क्वेश्चन तको पचर जो.
Question raised by Bikram Das. There is a hand raised. Bikram Das, would you like to ask your question? You are on mute.
Yeah. He's on mute still.
You are still on mute, Bikram Das. Would you mind unmute yourself?
Yes.
Hello.
Yes.
Hello. Am I audible?
Yes.
Professor Panda, Covaxin और Covishield ଭିତରେ କିଛି efficacy wise difference ଅଛି କି? କାହିଁକି ନା କଟକ ଲୋକ ବହୁତ ପ୍ରିଫର କରୁଛନ୍ତି ଭୁବନେଶ୍ୱରରେ ଯାଇକି କୋଭାକ୍ସିନ ନବା ପାଇଁ.
ନାଇଁ, the other story is Bhubaneswar लोग prefer କରୁଛନ୍ତି କଟକ ଆସି Covishield ନବା ପାଇଁ. that I told at the beginning. This is like a arranged marriage. तो ସମସ୍ତେ ଭାବୁଛନ୍ତି ସେ ଆରଟା ଭଲ ହେଇଥିବ. So my scientific assessment, actually, Covaxin has definitely predicted lesser efficacy than the Covishield. As you have seen Dr. Mishra's presentation, it's 81% against 90% of the Covishield. The Covishield being a live vaccine, Covishield got a live vaccine. So बहुत लोग को Covishield नला परे ज्वर हवा, देह हाथ गोड़ काटिबा, किछि symptoms रहुची, तो से जानी पारुचंदी जे वैक्सीन टा काम करूची किंतु कोवैक्सीन बीइंग ए किल्ड वैक्सीन मोस्ट ऑफ द पीपल डोंट हैव ए पोस्ट वैक्सीनेशन इफेक्ट किछ तंगर माइनर की मेजर किछ इफेक्ट रहउनी तो दे से माने डाउट करूचंदी वेदर दिस वर्क्स और नॉट एंड दे आर रेजिंग द एफिकेसी बट इट इज ट्रू दैट एवरीवन the best thing has happened by launching 2 vaccines in India and anyone who takes because I am giving an example. AIMS employees went on strike not to take Covaxin because it was in phase 3 trial. But the Prime Minister and the Chief Minister of our state have taken Covaxin only. So my suggestion is not to get into the differences. Whichever vaccine is available by chain, we should take. Practically, there is no much difference in antibody formation.
Exactly. सेई लाइन रे मु क्विकली गोटे कहबी यूएस रे भी सेई सिचुएशन हेची फाइजर आ मॉडर्ना दीटा अछि सो दीटा जाको इक्वली इफेक्टिव तण जहां प्रथम मिलुची सेटा नै जाउ
तो नेक्स्ट क्वेश्चन फेसबुक रो प्रणति प्रियदर्शनी दीटा क्वेश्चन पचारचंती हेलो सर आई एम एसएलई विथ ऑटोइम्यून हेमोलाइसिस कैन आई टेक वैक्सीन दैट इज द फर्स्ट क्वेश्चन सेकंड वन आई एम टेकिंग 7.5 milligram steroid every day can I take the vaccine
is Dr. Sadiq available?
No, Sadiq is not.
Okay, tahle I think I'll just make it quick. Yes, please go ahead and take it. You need it more than anybody else.
Just tell them that not to take the steroid 1 week before and 2 weeks after the vaccine.
Correct. Thank you, Dr. Kyle.
The next question Zoom Zoom questionnaire.
Rashmi.
Yeah, the next question is during peak time, industrial oxygen were being used to hospitals. In other hand, some oxygen issued to COVID patient. Is this a link between black fungus? So I think
there is a big debate is going on. Shall you take it in the next week questions?
Yeah.
Let's do that.
The big debate is going on.
Next one is sorry.
Hand raise ke karchandi.
We can take to get it to Priyabat Naik. Because that is already done. Priyabat Naik, would you mind?
हाँ जी नमस्कार हाँ मोर आउ गोटे प्रश्न थिला आमर बौद्ध जिल्लार कथा कहूची आज जने गर्भवती महिला मेडिकल आस्थिले तो तांकर केस आसिला तो तांको मेडिकल जानला संध्यारे मेडिकल को तांको अलाउ कले नाही तो सी तांको रेफर कर देले बुरला तो तांको किछि एम्बुलेंस भी तांको किछि सहयोग कले नाही साहाय्य कले नाही सी महिला जनक संध्या टू पूरा सकाळ पर्यंत से छोट बडक हे कि ही से बारंडारे ही रहितिले तो किछि ट्रीटमेंट नाही कि मेडिकल कोनोसी गर्भवती महिला जेहेतु से गरीब लोक थिले आसी कि मेडिकल पहुंचतिले तो कोविड पॉजिटिव होला तो से माने से बारंडारे ही बाहर रहिबे ना तांको किछि मेडिकल एमति किछि सुविधा अछि
आपण से क्वेश्चन टा मु नउची से क्वेश्चन आपण सब्यसाची मिश्र रो जो अछि ऑनलाइन फॉर्म रे सेठी भर्ती करी की ट्राई टू रीच देम हमर सेठी नेटवर्क अछि ना वी विल ट्राई टू हेल्प यू आउट देयर टू कनेक्ट
मेसेज चलची चेष्टा चलची बहुत लोकन को सेमति सहाय्य करा होची समस्तन करा हबो जदी हम पाखरे से आसी की पहुंचीबो रिक्वेस्ट
तो नेक्स्ट क्वेश्चन हम जिबा फेसबुक थ्रेड रो विनायक महांती पचारचंती लेट्स से आई हैव टेकन 2 doses of vaccine 2 doses of Covaxin and in future another vaccine will come with 100% efficacy can I take that vaccine in future please advise
so that is information yet to come but jaha jana paduchi जेमती आमे फ्लू पाई बूस्टर नउथिले सब वर्ष सेमती वर्ष को थरे हमको वैक्सीन नबा को पड़िबो एंड यस नै परिबे अपन जेतोल सिटा आसे
No, Sangeeta, actually what he means is, suppose he has taken the Covaxin, the booster should be the Covaxin or Covishield or any other vaccine which comes. That's what he's asking.
Yes.
The short answer is no, we don't know.
Okay.
We don't know.
Exactly.
Yeah, there is no data yet.
so next question is Zoom ro question section ko
Okay, the next question is there an age criteria for vaccination in India? My father is 80 years old and having type 2 diabetes. Please advise possible vaccination.
So definitely तांकर जो एज अछि आ डायबिटीज अछि हमें आगु भी जोटा कथा हेतिले निहाती नेबे
There is no upper age limit.
Correct.
So
there is lower age limit.
So let's make a change here.
Yeah.
I think Sangeeta is tired. Dr. Atosh Naik, can you take over? Coordination.
Yeah. Okay.
So let's make sure everybody responds by 30 seconds. We have to finish all the questions.
yes
Thank you.
so
Okay.
next hochi hataji raise karchonti Zoom re
Okay.
Galaxy M20. Sorry, would you mind put your name We don't know how to address you. It's Galaxy M20. Raise your hand. That's the only raise in Zoom right now.
हाँ हेलो मैम नमस्कार
हाँ
हेलो
कौन आपण क्वेश्चन कोन पचारंतु
हाँ तो मते गोटे जिंस जानिबार अछि आज्ञा
हाँ कोन
हेलो
हाँ कोन
हाँ किछि लोक वैक्सीन नै के आज्ञा खराब कोन पय हेजंती
एक्चुअली एटा बहुत बढ़िया क्वेश्चन पचारचंदे आपण फॉर एवरीबॉडीज इंफॉर्मेशन मु जस्ट कहबा चाहूची कि कोविड वैक्सीन डज नॉट कॉज कोविड वैक्सीन जो माने नउचंती तांको कोविड हबनी बिकॉज दे हैव टेकन द कोविड वैक्सीन सो एटा आपन को मन रखियो पड़ो तांकर जो देह खराब होची दैट इज अन्य कोनसी रीजन अछि मे बी तांको इनिशियली मे बी दे हैव सम साइड इफेक्ट्स or maybe they got COVID infection pore tanku hala kintu COVID vaccine je COVID koribo there is no scientific evidence COVID vaccine does not cause COVID
आज्ञा
अच्छा तेणु तार अन्य तेणु आपण जदि दा देह खराब हला आपण डॉक्टर लोकल डॉक्टर को देखांतु कोन पय हेची इज इट बिकॉज तांको कोविड हला कि तांको अन्य कोनसी वायरल इन्फेक्शन हेची और अन्य कोनसी रीजन अछि काहे कि तांको देह खराब अछि
आज्ञा डाइट कर जाउछंती सर सेटा मु जानिबो
not because of COVID vaccine. COVID vaccine जो समय तांको मे भी तांको COVID हेतला COVID बहुत लोक माने यू नो मरुचंती तार अन्य रीजन अछि लाइक ब्लड क्लॉट एंड अदर थिंग किंतु नॉट बिकॉज ऑफ COVID vaccine. So एटा आपण मने रखंतु समस्त कोंतु you won't get COVID because of COVID vaccine.
आज्ञा सर थैंक यू सर
नेक्स्ट क्वेश्चन हमें जिबा फेसबुक थ्रेड रो प्रशांत साहू पचारचंती डियर सर my mother aged about 57 and she is suffering from urinary disease. When she takes medication, she faces medication reaction and some marks shows on her body and body pain starts after 2 to 3 hours. Can she take COVID vaccine? Sir, please advise. Regard.
Vijay, you want to take this? You see this patient, this type of patient every day. Go ahead.
Yeah, most likely if she has urinary infection, she's having side effects. It could be that she is reacting to ciprofloxacin, the antibiotic. So just one reaction alone does not mean that she cannot take the vaccine. So it's actually good for her to take the vaccine. Now, if you have someone who has multiple reactions with different medications and things, then it may be a concern. But just one simple antibiotic reaction with one antibiotic is not a reason. So I would recommend taking the vaccine.
Okay.
Yes.
The next question, Zoom thread ro. Rasmi.
Yeah. So this question is more on like it's not a general information question. Like, are the doctors charging rupees to release COVID patient body? Heard about it? It's so ridiculous and to stop. Like 4 to 6 lakhs they are charging for ventilator. So how to deal with that? It's from RD. The name is not mentioned clearly. It's more like.
Devashish, you want to take this question? It's kind of a, you know, people are charging 4 to 6 lakhs for ventilator and not releasing body and all these things. So so they want to know what should we do?
Yes, thank you, sir. And this is a good question. This is a very passionate question, and it is very close to our heart. ଆମ ହୃଦୟକୁ କାହିଁକିନା ଆମ ନିଜ ଲୋକ ବି ଆମେ ଦେଖୁଛୁ ମୋ ଶାଶୁ ବି ଲାଷ୍ଟ ଇୟର ହେଲା we had the same problem, but unfortunately we can do so much. ଆମେ ଏଠୁ ଦୂରରେ ରହିକିନି ଆମର ଯୋଉ ଡାକ୍ତରମାନେ ଅଛନ୍ତି ଓଡ଼ିଶାରେ ଇଣ୍ଡିଆରେ ଗଭର୍ଣ୍ଣମେଣ୍ଟ ହସ୍ପିଟାଲ ଅଛନ୍ତି we hear that, but ଆମେ ହେଟାକୁ we have no power over that. But what we can do is we can write a letter to the government. ଆମର ଯୋଉ ସବୁ ଅଛନ୍ତି partners ଅଛନ୍ତି, friends ଅଛନ୍ତି, we can write to them a letter about this. Definitely, and we'll take steps, whatever way, little way we can. Thank you.
Next question, Hataji raise kartungi Rashmi.
There is one from Sanjay. Sanjay, would you mind unmute yourself?
Hello, sir. Hello.
Yes, we can hear.
Hello. Hello.
Sanjay,
Sanjay, go ahead.
ଆଜ୍ଞା ସାର୍ ମୁଁ ଜାଣିବାକୁ ଚାହୁଁଛି ଆମ ଭଉଣୀ ଯାଇଥିଲେ ଭ୍ୟାକ୍ସିନ ଦେବା ପାଇଁ କିନ୍ତୁ ଭ୍ୟାକ୍ସିନ ଦେଲା ପରେ ସେ କୋଭିଡ ପଜିଟିଭ ହେଲେ ଓ କିମ୍ସରେ ଆଡମିଟ ହେଲେ ମୁଁ କହିବାକୁ ଚାହୁଁଛି ଭ୍ୟାକ୍ସିନ ନେଲା ବେଳେ କିଛି ପଦକ୍ଷେପ ନେବା ଦରକାର କି କିଛି ପ୍ରିକସନ ଆଗୁଆ ନେବା ଦରକାର କି ଭ୍ୟାକ୍ସିନ ସେକ୍ସନ ପଜିଟିଭ ହେଇକି ଆସିଥିଲେ
संजय मोर क्वेश्चन होची से कोन वैक्सीन नैतिले डिड सी टेक दुईटा जाको वैक्सीन ले कि नहीं
नहीं सर सिंगल वैक्सीन कोवैक्सीन नैतिले कोवैक्सीन नो नबार 4 दिन पर कोविड पॉजिटिव हेले
अच्छा ताला हम एटा बहुत थोड़ा हम करिछु Dr. Ponda, you want to take this?
Actually, don't. My suggestion is don't correlate a positivity with the vaccination. Vaccine आपनको केबे positive करिवनी. आपण first dose नहीं चंती, second dose नहीं चंती, बा गोटे dose नहीं चंती. जेहेतु pandemic अच्छी, first wave जाइची, second wave चलीची. Anytime you may be infected. You may be infected before any dose, after first dose, after second dose, anytime. That is not because of the vaccine. Because of the vaccine, the infection will be less severe and chances of survival is more.
So the one thing is most likely the person was not wearing a mask. A lot of people kind of gather when they get vaccinated. It was actually somebody who was sick there, passed it on.
Actually, आमे बहुत थोड़ा डिस्कशन करछो आम ग्रुप रे इवन समरेंद्र आल्सो कनकर कि जो माने वैक्सीन पय जाउचंती जोटी से माने लाइन रे अपेक्षा करचंती किंतु मास्क पिंदु नांती सेठु तांको कोविड तापरे कोविड वैक्सीन नउचंती तापरे तांको किछि दिन परे देखुचंती कोविड होउची सो दे हैव टू बी केयरफुल सो whether you take vaccine or not whatever you do you have to wear mask.
Very true, very true. Possible that they'll bring the infection from there.
That's right.
So I think
point होची जे वैक्सीन नबार आमे समस्त जानिचु किछि सप्ताह परे इम्यूनिटी टा आसुची तेनु जाहाकु 3-4 दिन परे कोविड होची तांकर एक्सपोजर आगुरु हेई सरची कि सेही समय रे हला तापरे तांको कोविड टा हला not because of the vaccine.
That's right, Subhasis.
Next question Facebook thread ru Subhranshu Maharana. A question already actually discussed heyi sarchi. If I take only first dose, how much it will protect me as compared to a person who already took two doses?
Already Dr. Ponda discussion करसजन. Dr. Ponda, you just want to mention it in few seconds again.
In the booster.
Now, after the first dose, how much is the protection? After the second dose, how much is the protection?
Yeah. This is actually if it's a Covishield, the protection is 70% after the first dose and 90% after the second dose. If it is Covaxin, no protection after the first dose. It's 81% after 2 doses.
That's right.
I want an important question from a senior citizen, Ms. Ruchira. My uncle 80, auntie 73, both of them had vaccines. They got infected after 1.5 months after taking the vaccines. They were extremely careful regarding hygiene, wearing masks and sanitizing. My uncle was admitted in a hospital and expired 3 days ago. How did it happen?
Yeah, actually, this is a very good question. Actually, it happened to my parents, but they are doing okay. My father is 86, mother is 84. After 1 month of 2 doses of Covishield vaccine, tanku hela infection, but fortunately they got mild infection. They're fine. It's a very good question. I think because basically we call it breakthrough infection. In breakthrough infection, USA data, Odisha data will go to the Odisha data. Samrendra and Dr. Ponda will tell us more. USA, the data which is breakthrough infection is about 9,235 people. This is CDC data from 100 million people have got, out of 100 million people, 9,235 people have got breakthrough COVID infection. And out of them, 9%, like 830 people have been admitted in the hospital and 132 people have died. So out of 100 million people, out of breakthrough infection, 9,235 cases, 132 people have died after receiving Moderna or Pfizer vaccine. It is USA data. So people can die, and particularly the most important thing which in this breakthrough infection is people who have died, they are elderly people, and they have some pre-morbid condition. So mu janini Odisha re jo breakthrough infection data, Somarendra, do you have any data on Covishield or Covaxin?
Odisha kotha na even India level re bhi ete clear data nahi about the infections and mortality after both doses. Jona nahi, but the apprehension is that every vaccine mu aji discuss karni on the variant, every vaccine claims ame variant jete astu taku protect karuchu, but there is no concrete evidence to show that all variants are protected by this existing. So I would not mu besi kichi koya chahuni because we still do not have information on this.
Okay. Can I say something? This is the very good questions, and say that people are dying even after taking 2 doses of vaccine, particularly, and the most of the patients are mostly elderly. And we need to check how many percent of the patients were having comorbidities. And when they goes to this COVID infection, their physiological level and physiological level or parameter has decreased, the chances of getting heart attack or any other COVID like renal failure getting chances is much higher compared to the normal people. So even in the extremely age group, even getting slight infection with the COVID infection, the chances is getting the mortality rate is much higher compared to the normal people.
Yeah, actually, but Devashish, I think maybe because he's elderly person, maybe he had comorbidity, maybe diabetes, high blood pressure, and all these things. So he became sick from that, and that may be one of the reason.
Can I add one more? Can I add one more thing? Yeah.
Go ahead.
So the big thing with vaccination is we have to also keep our immune system in top shape. So basically, especially, it's so important for the elderly, because if you do all the right things with the right foods, exercise, sleep, and maybe add maybe some vitamins and all, your immune response will be much better. So when you have a better immune response, you definitely will fight the infection much better. So that's one thing. Like, so, you know, so for those who are kind of elderly, definitely kind of work on the immune system.
Atasu, let me add this one.
Yes.
The most latest, they say after 25 million vaccinations in Europe, 26 cases they have the COVID. I got a report. And USA, whatever vaccines, you know, some 100, some 200 million something, we have 9,000 cases got COVID in
India. That's right, 9,235. Yeah.
Thank you. Let's go to the next question. There are a lot of people in Facebook and Zoom. A lot of questions there. Let's limit our discussion.
Yeah.
And go to the question.
So there was my next question. Prasanth Naik pacharchandi Facebook thread ru. Sir, please, one question to be noted. Any viral infected patient like HIV, flu, can they take COVID vaccine?
Anyone take? You can. Others for you decide.
Anybody wants to take this, Dr. Ponda?
Yeah. If patient has HIV, patient should take the COVID vaccine because they are immunocompromised patient, and it's recommended they'll take not only one and two doses. Regarding flu, what he has asked?
So say same question. Jadi ki active flu achi nahi paribo ki nahi vaccine.
It's better not to take during active flu, because if somebody runs fever and there is malaise, it's just to postpone till the fever subsides, because after the episode only the vaccination process is completed.
Is he taking any medication for HIV?
See, segura kichi mention karna di. Next
let's
question ami diba Zoom thread ru.
Yeah.
Next question is, we have somebody, Rinki Agrawal. What about blood clotting after vaccination? We have a lot of rumors on that.
Yeah, that's a actually very good question. Actually, I was just going to discuss that. I think we have Dr. Jena, from Professor Jena. Please go ahead. Then we can discuss for a few minutes. It's a very important thing.
अच्छा जोटा माने ब्लड क्लॉटिंग कथा कहले आपण माने जानि थिबे ब्लड क्लॉटिंग किबा थ्रोम्बोसिस इन द फॉर्म ऑफ डीप माने डिवेन थ्रोम्बोसिस कोंतु बा पल्मोनरी एम्बोलिज्म कोंतु बा जे कोनोसी हमर रक्तनळी रे थ्रोम्बोसिस हो इट इज आल्सो आपण वर्तमान टाइमिंग पाई मन कोविड कथा भूली जानतु आपण जदि देखिबे इन जनरल इट्स इंसिडेंट्स आल्सो इट विल बी अराउंड 1 to 2%. Particularly there are certain risk factors like obesity, diabetes, smoking, hypertension, dyslipidemia, your sedentary lifestyles. एगुड़ा सब factor था. Second, जो मन को thrombosis report है ची particularly माने कोविशील्ड vaccination पाई ताकू तापरे तले further evaluation करके देखा गला जे some thousands vaccination नहीं सला परे hardly few numbers are showing the thrombosis. जोटा कि इट मे बी ए नॉर्मल इंसिडेंट्स आल्सो तेणुकरी से आमे उपनीत हेलु साधारणतः हमर डिसाइड हला जदि आपण आर कॉस्ट बेनिफिट एवं रिस्क बेनिफिट रेशियो देखिबे ये जो इंसिडेंट्स ऑफ थ्रोम्बोसिस की सीवियरिटी ऑफ रक्त जो जमाट बांधुची इज वेरी मिनिमम इन कंपैरिजन टू दी बेनिफिट व्हिच इज गिवन बाय द माने वैक्सीनेशन तेणुकरी से जो मन को तो अत्यधिक क्लॉट जो होउची पर्टिकुलर केतटा वैक्सीन रे एटा को हमें माने भूली जिबा वी शुड नॉट पे मच मोर अटेंशन. दिस इज पॉइंट नंबर 1. पॉइंट नंबर 2 एटा काहे केता हाईलाइट हला बिकॉज़ देयर इज आई पर्सनली बिलीव इट इज अ जियोपॉलिटिक्स. देयर इज अ कॉन्फ्लिक्ट ऑफ इंटरेस्ट. द कॉम्पिटिटर्स ऑफ द वैक्सीन्स दे हैव क्रिएटेड बहुत ओवाला कले प्लस इन एडिशन टू बाय सर्टेन insensitive discussion in the electronic media जोटा माने कि अति भेग वे रे हाइलाइट करके जो मन डिस्कशन करा गला जोथि पई कि एटा एते हाइलाइट हला बट प्रैक्टिकली रक्त जमाटो इन एनी वैक्सीन पर्टिकुलरली कोविशील्ड रे इट्स ए वेरी नॉन क्लिनिकल आर किछि एतडा इंपोर्टेंस नाही वी शुड ऑलवेज गो वाइड irrespective of the risk.
Thank you. Let's please get to some other questions quickly. Good question achi.
The next question Facebook thread रे होची can pets get coronavirus COVID-19? Answer please, doctor. Thank you.
What is the can face?
Pets get coronavirus.
পোষা জীব
Anybody wants?
Yes, the answer is yes. We have got COVID in cat, dog, and also the animals of the zoo. But the way humans are infected, nobody is putting much emphasis in them. But once upon a time in Odisha, we have tested even animals. So the answer is yes. There is evidence that pets are infected, but they can spread or not, or how they can be treated. That's a different story.
So we have tested here. We have people has seen the cat has transmitted the disease virus
to humans. To humans.
To the humans.
Okay.
Cat.
Yeah,
Particularly cats.
Yeah. Thank you.
The next question Zoom thread ru.
Yeah. The next question is we have a lot of questions regarding black fungus, but I think we will delay that until next week.
Yes.
There is a question from Dr. Sadhu Chandra Pandar. He's asking about the people's choice on AB test or HRCT. Doctors should explain the scientific basis not to go for this and discourage them. So he wanted to shed some light on that.
Vijay, you want to take it? I think this is your forte.
Yeah, I guess, the question is whether to do HRCT or not.
Yeah, want to do the CT. That's right.
Yeah, the thing is, the CT is never indicated for anybody who's doing well. About 80% will be doing well. The oxygen will be good. So unless you have trouble breathing and the oxygen is in the 80s, like low 80s, there's no need to do a CT. So if your oxygen is always above 90, you have no symptoms and all, and you're doing okay. Even if it's like up to 94, 92, it's okay. Now, when it drops to 92, you may want to start doing some more testing, or maybe go to the hospital, get checked out. But HRCT is not the way to go initially, no.
Well, Vijay, let me add this. More ICU re, we got rid of doing any CT. The CT has nothing. Initially, we are doing. Kana? CT scan ku nela you are spreading infection also. CT tama bed package CT habani. So CT scan cannot add anything. We have enough from the clinical, even chest X-ray and clinical evidence from ventilator parameters. We know, and he's COVID positive. We treat without CT. I think to me, CT scan India ete CT scan hoji. They are unnecessarily, putting them to radiation. So, lokangar cancer bahut hai jibo kidin pare.
That's right.
That is true. You are right, Dr. Basanta Bhai. CT does not make any CT does not added any treatment process. It is only chest X-ray, and as long as your saturation dropped to 92%, you should treat by yourself, not CT.
CT nothing.
Okay, Basanta, can I have a quick comment? Yes. One sentence only. Look, I think I agree with you. Basanta jaha कहला एबे भी मोर mother-in-law भी COVID-19 infection एक very critical AIMS भुवनेश्वर रे ICU रे अछंती तांकर decision भी सया. The CT never adds so far management is concerned. Clinical other parameters you can jolly well treat. No CT is really going most of the cases.
Thank you. Let's move to the
next question. Next question Facebook thread ru Rishikesh Shahu pacharchindi, sir, my father got vaccine first dose and now he's COVID positive. Can we do what can we do in this matter? So we already answered this question.
Yeah, go to the next one. We discussed many times.
Yeah, we should go to next question. Nikunja Kumar Jena pacharchandi, sir, मोर 5 मासर पुओ अछि, मो स्त्री टीका नै परिबे कि काहे कि ना पुओ मार खीरो ही खाउछि.
Yeah, it's a very good question, Samarendra. You want to? I think we already discussed about the lactating mother.
Guidelines are saying, I don't know.
Yeah. So Actually, in US it is different, but Samarinder can let us know about what they're doing in India and Odisha.
Yes, for lactating mothers, it's allowed. The choice is with the mother. I mean, if the mother is very much at risk, they can take the vaccine.
But in USA, the answer is yes, definitely.
Yes.
Yeah, UK is yes. They're giving everything. Yeah.
So next question हम इस Zoom thread को.
Okay, we have Prabhat Kumar who raised his hand. Would you mind ask your question, sir? Then we'll go to the.
So my father-in-law, hi everybody. My father-in-law got positive after 2 months of full vaccination, and as you told, CT scan may not add any value, but we just got the CT scan, and his saturation level is still 94. But we do not want to take any further risk, and just want to get him admitted. So what do you say?
Okay, we have discussed many times. Basan Bhai, why don't you explain this? Saturation is 94% and CT, I think you must have got a CT score, in India, they give a CT score like mild, moderate, severe.
14 to 15.
14. So CT score moderate. So moderate infection in the CT and saturation is 94%. Should we get admitted in the hospital or not? My answer is no, but anybody, Basan Bhai, Basan or Vijay, you want to take this?
Yeah. So I think now what day is a person? Which day is it?
This is 5th day.
5th day. Okay. So usually the way the disease progresses is the first maybe 5 to 7 days, the oxygen may be good. 94 is still a little low. Now the next 7 days is a little more critical. So what we do here, like I'm a family physician, I treat a lot of COVID cases. So my initial treatment is to kind of leave them on some Ecosprin or aspirin, a small dose, and see how the oxygen progresses. They don't have to go to the hospital yet. If the oxygen drops like maybe to 92, 91, 90, then we would be more aggressive with 2 more things. So we would add an extra blood thinner and also add some Decadron. So the big thing is now we have, of course, as a physician here in the US, what I would do is I would start him on Xarelto 10 or 15 along with a small aspirin and then add like Decadron. And I've actually had patients who had an oxygen of 88 and 89%. And with just this combination, within 7 days, he was back to 97%. So he's, but then again, it depends on the physicians there, on how aggressive they are. If they feel like they cannot do it, then he has to go to the hospital to be admitted for anticoagulation, which would be Lovenox with some steroids.
It's a patient code USA na India?
India.
India, I think Jayant Panda can answer.
Sir, more choto prashna Vijay sir go. Sir, aspirin has any role in management? Antiplatelets?
Yeah, thing is in COVID, actually, see, nobody knows about what's happening. Basically, this is more.
Sir, at India, in no guidelines, we recommend aspirin and low molecular heparin and oral novel anticoagulants are recommended depending on the D-dimer and the risk of bleeding disorders, thromboembolism and prevention.
Right.
But
aspirin, how does aspirin work? It's an antiplatelet agent.
Jayant, I will come here.
Okay, go ahead, Doctor.
I'm Basant अच्छी समय. Actually, I will agree with my previous speaker. Jayant to देखो तो बहुत जिनस इथरे extrapolate करी कराई data. Even the role of low molecular heparin, anticoagulation केमिति दिया जिबो, to what extent केते दिन दिया जिबो, तार dose कौन. These are very many contentious issues. हम extrapolate कराऊँची. Second point होची जो Jayant अबू कहले guideline कौन. The expert jahata koibe, the government approves, that becomes the guideline. Aspirin, rather, I will go in favor of aspirin. Kind upon jodi taro pathophysiology dekhibe on coagulopathy. Activation of the platelet is also one of the pathophysiology in this dysregulation of coagulation. So jodio data amo pakre nahi, I cannot side with data, but there is no harm in giving a low dose of aspirin along with the anticoagulants. That's my point. It's extrapolating the data.
Actually, no, Dr. Panda, let me tell you one thing. I have treated at least 400 to 500 patients of COVID, and all my cases are outpatients. I can't treat patients in the hospital. So basically, when I look at the coagulative process, you have to kind of block the platelet side of it and also the fibrin side of it. You have to, you have to kind of
That's
block
why I
both
wanted to know,
that
know
sounds
from you.
Yeah.
Sir,
Yeah.
One second.
And to answer, sir, to answer Prabhat's question, this gentleman should be admitted because in India things are little slow for him to take to the hospital, and when it comes below 94, he'll be at risk. So now he has to call 1929 or 104 and get the ambulance and get him admitted to any dedicated COVID hospital.
No, thank you, John.
Okay.
This
Good
is,
sir, good to see you.
let me one
Any-
Next question.
one second.
any specific hospital?
Hold on.
One
Hold on, please. Nihar, hold on.
No, no, one
Sorry.
Uh,
I request everybody not to discuss therapeutics. We already told
Please.
not discuss.
Let's now change topic. Thank you, Atasubai. So we will go for a rapid fire question, yes or no. Okay, we have a lot of questions here. I would call the name and please just say yes or no. Number one, sir, vaccine naba kono jaruri ki Facebook ru? Yes or no? Who will-
Yes.
Yes. Okay. Yes. Now the next
Yes.
question is, my son is having epilepsy. Can he take vaccine? He's 25 years old. Yes or no?
Yes. Yes.
Okay. Next thing, I'm 53 years old. My eyes getting reddish around 25 days. Is it COVID positive? Yes or no?
No.
No.
Good.
Yeah.
Next is Manik Datta. My mother is psychiatric patient of MDD, last 30 years of age 65. After taking Covidshield of first dose, she deteriorated her health. She suffered restlessness, insomnia, forgetfulness. Kindly suggest what might be the reason. My psychiatrist admitted her for 5 days, then titrated her medicines. I am from Cuttack.
Not due to vaccine.
Okay.
That's
thank you.
right.
Next question is Madhusmita Mishra. Can vaccine be taken during menstruation?
Yes.
Yes.
Saswat just not Chandramani Sahu. Sir, corona vaccines, the nothing taken. Who is the problem? Please tell, sir. We couldn't understand the question, sir. Next question is vaccine nele kichi habani to? Yes or no?
Kichi abani.
Bhala habo.
Okay. And second, last is Zoom question. Rashmi, can you ask quickly? Yes or no?
There are not many, bhai. Most of them are like black fungus based. There is one question pending actually, which we just want to like partially we covered already. Any COVID patient after recovery, is there any chances of reinfection? And what would
Yes.
be the level?
Yes. Go to the next one. Next question.
And would you mind cover some oral hygiene regarding recovering from COVID?
Yeah, this is very simple. You have to keep your mouth clean. Please don't chew pan, and whatever food you take, please brush after taking food.
Excellent. Next question. Rashmi.
To give steroid part of the COVID treatment, and that's what is causing black fungus.
Next, black fungus will answer next week.
I think that's it. Rest everything is black fungus. We covered all the questions. If
Should we tell a single line regarding black fungus because so many are interested? They cannot wait till 1 week. So in 1 minute, I am telling you, black fungus is a saprophyte, a opportunistic infection present everywhere in the environment. This is like a very common thing in your home, soil, garden, manure, moss, everywhere. So ଯେତେବେଳେ ଆମେ डायबिटीज कंट्रोल करवानी स्टेरॉइड बेसी दिन धरिकी नबा जोटा कि मिनिमम 3 वीक्स आउ कोविड रु रिकवर करथिबा एई जो सैप्रोफाइट बा ऑपर्चुनिस्टिक इन्फेक्शन बढ़ी जाए जोटा कि हमें डायबिटीज रे आगु देखिछु अनकंट्रोल्ड डायबिटीज रे तो द फर्स्ट प्रेजेंटेशन जे यूनिलेटरल नाजल ब्लॉकेज यदि गोटे पट नाक बंद हबो तो आपण संदेह करबा कथा जे एटा हल्ला की तापरे यदि गोटे पटे आखी फुलिबा नाक फुलिबा लाल पड़िबा आखी पत्ता पड़ी जिबा मुंड बिंधा हबा और नाकरू कला पानी बाहरला ताले हम परीक्षा करियो पड़िबो खाली ब्लैक फंगस थिले हबनी इट मस्ट प्रोड्यूस पैथोलॉजी इन्वेजिव हेतिबा दरकार इन्वेजिव राइनोसेरिब्रल म्यूकोरमाइकोसिस तो सेरिब्रल छड़ा राइनोसेरिब्रल छड़ा हमरो जीआई ट्रैक्ट हमरो स्किन हमरो मिसलेनियस बा डिसेमिनेटेड आउ डिफरेंट ऑर्गन्स भी इफेक्ट हवार एविडेंस रही डरिवार किसी कारण नहीं शॉर्ट कोर्स स्टेरॉइड रे डायबिटीज कंट्रोल रखंतु स्टेरॉइड डॉक्टर को सुपरविजन रे खांतु
excellent I got a question
Professor Ponda, could you also elaborate on the antibiotic usage that is also partly responsible?
Yeah because
Talk about
there
it.
are because बहुत एमती औषध अच्छी ताहा ब्लैक फंगस करे थाए जेमती कि voriconazole गोटे एंटीफंगल मेडिसिन that predisposes to black fungus. Even oxygen therapy जदि ठीक आमे humidifier रे clean water दबानी और oxygen therapy भी indiscriminate दबा सिटा करे थाए सेमती antibiotic higher antibiotic indiscriminate use for prolonged time can deplete your prebiotic, probiotic, and the beneficial bacteria in the body and predispose you to any fungus, black, white, yellow, any fungus. So we have to be very careful not to use antibiotic, higher antibiotic for prolonged time also.
Bijay, we will discuss that next session. Thank you very much, Dr. Panda. And I think we caught up with all the questions in Zoom and Facebook and no hands raised.
We have one more question, bhai, in Zoom.
Wait, quick, yes or no, quick.
Yeah, are the vaccines safe for someone who is Guillain-Barré syndrome during childhood? During this Guillain-Barré syndrome treatment, he was told not to take flu vaccine. That's why. This is from Bajrendra Nath Panda.
So who wants to take it? Panda sir,
I think Ajit can take it because this Guillain-Barré syndrome was reported in the UK from the. Do you remember Ajit from AstraZeneca vaccine? There are a few patients were. Why don't you just mention answer it?
What is the question was there?
Means he had a Guillain-Barré syndrome in childhood. Can he take the vaccine? He has been told that he cannot take flu vaccine. Can he take the COVID vaccine?
I think we have not seen the data. They have produced the Pfizer. We have 7 cases of Guillain-Barré syndrome. We have reported, but that is coincidental. Probably he can take the vaccine because whatever the incidence has quoted is coincidence.
Yeah, but
it's not due to the Pfizer vaccine.
Right, but I would still recommend discuss with your private doctor for this for specific because we don't know the details. I think we caught up. So one inspirational story I just want to share with you all. This is from Saswat Joshi, one of our patron also. Pranam to all. Just for information, my mom took the first dose vaccine, Covaxin. She got positive. She's diabetic, heart surgery 2 years back, but with complete home isolation, moral support, she didn't go to hospital. And she came out with negative report, and now she took the second dose. She's absolutely fine. Thanks very much. This is for just an inspiration, willpower. Thank you, Sashwat. And so I think we caught up everything. Nihar and Rashmi.
Most of the questions are answered.
I am taking 7.5 milligram steroid with calcium. So that's fine. So I think we are done. I think.
Last one, closing. I've been in dry cough since 20 days and I took my first vaccine. Is it COVID?
No.
Good. So saying this, I would thank all the experts here who answered the questions. We took lot of questions and a very educative and informative session. And we thank our audiences, those who participated, and our audiences are growing every time we go there. Next session, we are coming with 3 very hot topics about black fungus, what it is, about mental stress and among family due to COVID. And other one is respect our frontline workers, because frontline workers are being attacked because of frustration and the chaos that has been spread. So we expect all of you to be here. I thank Archita for being here and championing our cause. Archita, is Sabya there? Archita, you're on mute. Is Sabya there?
Actually, I would a webinar achanti, so join right now.
Sure, that's fine. So thank you all, thank you everybody, and great job. And let's keep it going again next Saturday. Thank you, everybody.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thank you.